Good morning, everyone. It's 9:30 Lisbon time, and we will start our microgravity workshop. My name is Joana Labart, Projects Officer at Portugal Space, the Portuguese space agency. And before we start with our first keynote speaker, the Minister of Science, I want to draw the audience some attention to some technical aspects that we will have to follow during this session. The first thing that I want to point out is that the audience throughout the session will have the possibility to ask questions to our panelists. And at the end of every thematic panel, we'll have a dedicated 10 to 15 minutes session where the panelists will answer your questions. To do so, you can write down your questions in the chat, and then I will address these questions to the different panelists and they will answer them. Also, I want to explain very shortly how the workshop is structured. As you know, we have 4 main blocks. 3 of them will take place in the morning and 1 of them in the afternoon. And the first block is dedicated to keynote speeches from relevant institutions here in Portugal. We'll hear about the Minister of Science, then about Portugal Space, ESA, and ICIP, the Clinical Research and Biomedical Innovation Agency, to understand better the space institutional point of view in Portugal and why microgravity is important. Then we will move on to our second topic, microgravity for quality of life, where ESA will explain us a bit about the SciSpace program, and we will also hear a bit the industrial perspective from Seminário Espacial and from MIT Portugal. Then at this point, we'll have a coffee break and we'll have a poll where you, the audience, will be able to answer some questions, and this way we get to know you better. And then we'll move on to the last session of the morning, microgravity for pharmaceutical and medical applications, where we will hear what the Faculty of Medicine of the University of Lisbon has to say. Also, we'll get some insight of what AstraZeneca is doing in this topic, and also the Otto von Guericke University. And finally, Space Pharma will explain us what they provide as platforms for microgravity. And then I encourage you to stay in the afternoon session, which also will be quite exciting, where we'll hear Dava Newman making a very inspirational speech. And then we'll get to know more about ESA commercialization efforts, and then also Olympia Space explaining what Blue Origin is offering. We'll also hear Virgin Galactic. And last but not least, Axiom Space will tell us what are the future prospects that they are trying to develop. So without further delay, I will pass on the word to the Minister of Technology, Science, Technology and Higher Education, Manuel Heitor.
Good morning to everyone, in particular those in the other side of the Atlantic. I believe it's quite early in the morning, probably join us later on, but let me welcome you to this seminar, which has a very single and pragmatic goal: look at the future, and essentially look at the unknown. What we have learned over the last 50 years is that microgravity provides unique facilities for new experiments, but also for improving the quality of all citizens by developing new products, new pharma products, by developing new insights into chemistry, and to speed up processes which will never be possible to be tested and developed at atmospheric conditions. And this seminar is timely because we all should be very proud at the world level to commemorate the 20 years of the International Space Station, a major global effort to provide a microgravity lab about 500 kilometers from Earth, which he has been providing rather unique insights into the future. And essentially, by understanding the way we can step by step evolving always in international collaboration has been the main goal of the establishment of the Portuguese Space Agency, a new and modern space agency looking at the way we could build the future, always under international collaboration, and particularly making bridges between the business sector and the research sector, looking at new conditions to help improving our life standards, particularly by understanding the way space and space-related systems can provide a new understanding. And this is more important than ever. We live in a unique sanitary crisis, which has called our alert for social and economic issues, which were not actually understanding how they could be real. And we know that this pandemic has started in animals, has passed to human beings, and that zoonotic diseases will increase if we keep the current standards of our life. Therefore, the pandemic is not more than one type of the unbalance we live today between economic and human activities and the mother nature. And we need more economy, but we need a different economy. And therefore, in order to achieve a better balance and to evolve under this new geological era, the Anthropocene, we need certainly a completely different set of products and systems, apart from looking at our planet Earth in a more inclusive way from space. That is the reason why the next decade will be particularly critical in developing new observation methods, but at the same time, new products and systems which will be totally different from those we know today. Is the only way that we can achieve a balance for future societies. And therefore, microgravity is definitely one, not the only, but definitely one of the major areas for future development, so that we can develop products and systems faster and better, and particularly products and systems which will provide us in a completely different sustainable environments where we better understand the end of life, but we can always use products and systems which do not increase our ecological footprint. This is a topic which I'm particularly interested in because I did in the mid-80s my postdoctoral studies at the University of California, San Diego, exactly in microgravity effects in combustion. And if you really want to understand the effect of microgravity, just think how a flame, a simple candle flame will be completely distorted by different gravity conditions. And a candle in a microgravity, as has been shown in the International Space Station, looks completely different at the human eye, but it has also characteristics in terms of luminosity, radiation, and thermal characteristics which are dramatically different from a flame under atmospheric conditions. This is a simple example, but the last 20 years in the International Space Station has provided clear evidence that many other products, particularly in the area of food products, chemistry, but more and more in direct development, we can not only speed up, but essentially do faster testing and better testing under microgravity experiments. And so one of the questions is to increase the range of experiments, but also to bring awareness overall over different economic sectors, from the food sector to the pharma sector. How can we better develop experiments and use microgravity for products and systems development? Certainly, the International Space Station has provided unique facilities and will continue to provide, and I will call all of you, particularly in Europe, which through ESA has access to experiments in the International Space stations to provide very interesting results, and later today we listen to some of those results. But there are also other ways to provide microgravity labs. Portugal in particular is collaborating always in the framework of ESA and more with the Italian Space Agency and the Italian government to make sure that in the years to come we will have a new microgravity lab, the so-called Space Rider, that can also provide a microgravity lab. And we will be particularly interested in providing the necessary basic infrastructures and landing infrastructures in one of the Azores Islands, so that we can also speed up in the European context the development of new products and systems, including in the pharma industry. And that is the reason why it is so important to bring to this type of workshop people from different industries, because we are essentially entering into the unknown and building the future. We don't know. Most of these experiments, we don't know which will be the results, but we need to experiment. And actually, again, our space adventures call very, very much, not only for our creativity, but for a completely new set of experiments which will certainly drive our future. A very interesting example is also the experiments which has been developed in Spain, particularly in Barcelona, and under a microgravity lab, also a space, a lab established in the European Space Agency framework with Spain. And again, many examples in Europe, in the United States, and throughout the world have shown us that we need to do more and better under microgravity conditions. So I call your attention, this is a field which Portugal will be more and more active, particularly to bring the young generation to a completely different new sets of explorations, particularly to provide the trust and to build new futures which are more sustainable, which are with a better quality of life. This is all about. Microgravity is designing the future. Thank you very much.
Thank you very much, Minister, for your very wise words. And to get to know better about the space sector in Portugal, we have here with us Ricardo Conde, the president of Portugal Space, who will be our second keynote speaker in the morning. Ricardo Conde, the floor is yours.
Good morning, everyone, and thank you to join us here today in this seminar. If I well remember, I think this is the first time here in Portugal that we are discussing this topic in a collective way, the microgravity. And because this represents for sure a vibrant discussion topic, and also because this is the role of the Portuguese Space Agency to promote space science, space research, space technology. Certainly this is a topic that makes so much sense to start to discuss in the Portuguese ecosystem, as the minister just said, and but in an international frame cooperation. We want to put on you the challenge to go forward in these discussions and promoting your ideas and more. We are here also to support your projects. This is one of the messages that I want to give to you all. We are here to support your projects. And for that, please let us know about your ideas, and we will help you to frame these ideas in the research projects. But I also want to have this opportunity to let you know more about the Portuguese ambition for space in this decade. So I will, can I share the presentation, Joanne?
Yes, you can, Ricardo.
Yeah. Okay, let me see if I can. I think you are see the presentation, right?
Yes, we can see it.
Yeah. Okay, very good. And now also?
Yes, we can see full screen.
Okay,
yes.
So I will brief present the what we are doing, what are the main challenges for this new creative space agency, and I will start that in 2018 the Portuguese government created a national strategy for space. This is a research, innovation, and growth strategy agenda for a decade in Portugal. So the main ambition is to Portugal becomes a space nation. And there are some actions on this strategy, but I will focus on the third, which is to building national capacity and skills and scientific research, innovation, and education and scientific culture. And this is really the scope of our discussion here today around this topic of microgravity. And then in 2019, it was created a space agency, the Portuguese Space Agency, which is an instrument for the government to implement a strategy for space. And this strategy, together with the National Space Agency, is an instrument in the international frame collaborations. And basically, this is to tackle all the opportunities that we are facing this decade to the new space markets, new space technologies, and of course, to leverage it and unlock the potential of the Portuguese space economy, and as I said, Portugal to become a space nation at the end of this decade. And we are, as a 97% of our territory is water. Of course, we are focused in this our main good, which is the ocean, Atlantic Ocean. So we are focused in Atlantic, and for that we are considering several challenges that represent our program, the Portuguese program for space. And this is the main goal to create an agenda for space in Portugal. Again, in the frame in collaboration with international organizations that Portugal belongs, and in particular in the European context, HISA is the main good example. And for that we have four, I will say 6 more great challenges, and that are part of our national strategy for space. I will start with the digital planet. I will address a summary of what we are, our ambitions on the digital planet, what we want to do. An Atlantic constellation, which is Atlantic constellation, is a network satellite constellation focused on Atlantic, not only, but the focus is on Atlantic. A 5G ecosystem for remote regions. I will explain you also better. The space innovation ecosystem in Açores, which is an opportunity and taking advantage of our geographic location, Açores. And of course, we will continue the capacity building in our institutes, in our research institutions, also universities, academia, and our companies. And this is also the frame that we are discussing here today, promoting research in space science. And about the digital planet, this is related with an ambition that we need to have more data, we need to have open data to foster and to try to see if there are a possibility to use this open data to develop the downstreams. So applications. I will give you an example about the GPS. Today, if we have several applications, a vibrant market use GPS data is because the navigation data is free to use, and we can use it without limitations. And this gives some freedom to develop some applications, and there are a specific market and some service based on that. We need to do the same for the data coming from the Earth observation in situ, and this is the frame of the digital planet. But the thing is, we need this data basically to know more, to know our ecosystem, to know the interactions between our planet, the space, the way we explore the resources. And it's time to see that the data is the answer for the science. And we are facing big problems that space can have an answer. I will address two videos that I have here to present to you, and to reinforce the idea that we need this data, we need this data to feed what we call, and with one of our ambitions, the digital planet, but particular to more about our ocean, to know more about what the interactions of our oceans, our sustainability, the way we see the sustainability, the way we explore the oceans. And to know more, to have more knowledge, we need to have access the open data. I have here a nice video to give you an idea. Let me see if I can play. Based on data from this is the evolution in several months, 4 months, around 4 months, and the data collected by Sentinel, how we monitoring the nitrogen dioxide emissions during the lockdown. So this is a very short example. I have another one here for Europe. Let me see if I can put here. This is also the data that we get from the Sentinels to show you the evolution of the emissions of nitrogen dioxide. This is something that is quite important. It's only possible because we have this frame of open data, and the scientists can use this data to know more about our environment. So I will pass this is quite long, I will not bore you about this, but the main topic here is we need this data to get more knowledge about our ecosystems, about the way we interact with our planet, but also for planning, also for tackle the problems of fires. So the sustainability of our environment, the way we interact, depends the way we know this environment. So that's one of our main challenge, to provide data. And for provide data, we have an ambition also, is to set up Atlantic constellation. The Atlantic constellation is at the end a cooperative satellite constellation. Together, when this is the entity will be responsible to implement this satellite network constellation. This is the Air Center, together with some partners, Atlantic countries, like UK, like Mexico, Norway, some countries that are part of the Air Center. And this aims to have 16 satellites with high resolution and time and space resolution, and will be focused on the Atlantic. This is the way we think that we can contribute to have really more data and open data for our society. Another challenge that we are so one of our programmatic challenges is the 5G. In the 5G, not only the traditional terrestrial 5G, but to combine satellite 5G to cover the remote regions. As I said, we are Atlantic nation with a huge area to be covered, but also a coverage for remote regions, not only Portugal, but in other associated countries. And of course, and certainly taking advantage of our location, the Space Innovation Hub in Santa Maria. So we are looking particular to a location that brings to us the opportunity to set up several projects. One of these projects I will address in more details, but particular to launch the launchers, assess the space. So is ambition of Portugal, also ambition in the international context, to install a small spaceport for small rockets, modern rockets for small payloads to access the space. And we'll take an advantage of our unique location with a free corridor to the south. This is an ambition of Portugal, this is an ambition of Azores, and this is a running process that we want to see if we have the conditions to this year, the end of this year, to start to give the next step to bring this to a new reality. And of course, the one of the pillars for the gateway and access to space to promote gateway, communication gateway to space. This is part also, the teleport part of the ground capabilities installed in Santa Maria, not only with the commercial services, like the teleport that you see in the picture, but also some scientific infrastructures related to the VLBI scientific investigations. But not only science related to rockets and communication gateways. As the minister said, we are involved with Italians and in the frame of HISA to have a living lab for microgravity, for example, research. This is the scope of our discussion here today. So there are a vehicle, call it Space Rider, which is a reusable vehicle, European reusable vehicle, that will be used for small experience on board. It will be launched in French Guiana aboard of Vega rockets, but it's foreseen to land in Santa Maria. And Portugal subscribed this program, and at the end of this year, we will have more news about the way to go forward. And this is a unique opportunity also for the companies to be engaged and to be involved in such activities of experience on microgravity. So there are a volume, 1 cubic meter, around 1 cubic meter of available space to embark your experience. And this is the challenge that I want to put on you, to know more about the Space Rider, and you have the conscience that in Europe, we will have this opportunity to embark in your experience to the microgravity environment. So this the Space Rider will be launched around the last quarter of 22. It's foreseen to start all the infrastructures, facilities in Santa Maria at the end of next year. So then the third quarter of next year, and there will be a landing area and also an experiment facilities that will be built particularly to promote this idea of this microgravity lab. And almost I will conclude. We are also here to promote capacity building in several platforms to leverage our industry to another level. We have a small ecosystem so far with the big ambitions, but we have a strategy to put our companies as a new role in the subsystems and some competences in the frame of HISA programs. So we want to create an industrial agenda for space in this decade. We want also to leverage our ecosystem and multiply by 10 our sector, in our space sector, that will represent at the end of this decade around 500 million euros. And last, which is important and you to understand, and this is the scope about our discussion here today, our seminar, we are also here to support and to promote scientific research activities, which is the case of our discussion here today related to microgravity. So space missions, space exploration, space medicines, and robotics. This is an example. So I will conclude here. Joanne, I give the floor to you, and I wish you a very fruitful discussions. And I will reinforce the idea. Please come to us if you have a good idea. We'll promote your idea. We will support your project. And this is one of the things that I want to see the outcome also of this discussion. Thank you.
Thank you, Ricardo, for your nice overview of the Portuguese space sector. And as you have mentioned, space is an international endeavor. And in Europe, the European Space Agency is certainly a major player. And to get to know more about what are the prospects, today we have with us Didier Schmidt, the coordinator of the Human and Robotic Exploration Program at ESA, who will tell us more about the renewed Science for Deep Space Outlook approach for ESA. Didier, the floor is yours.
Good morning. Do you hear me?
Yes, we can hear you, yes.
So do you see me as well?
Yes, we can see you.
Good. So yeah, thank you very much also for the minister for his nice scoping of the meeting and the overview of space activities of Portugal. I will now move to the core, so to say, of today, which is space exploration, which is a big framing. Of course, microgravity is only part of it. And I will now switch to the presentation. Do you see it?
Yes, we can see it.
Good. So first of all, I would like to say a few words about the international context, because in the next 2 years, we will see quite a lot of change in the exploration framework worldwide. You have seen already that the access to the space station is now on a commercial basis in the US. This will be further developed next year with a Boeing capability. And you see also very regularly in the news that the commercial access either to orbital or to low Earth orbit is also based on a commercial basis in the US. So this will change quite a lot the landscape. Now, of course, NASA is also continuing its activities for exploration, and next year NASA will launch its launch system, which is equivalent to 60 years ago to the Saturn V launch. So it will be quite an event, and I will speak about this a little bit later. But other nations, like for example India, will also like to have access to low Earth orbit with manned vehicles, and they will do a test flight next year. And probably the most important change will be also starting next year with the assembly of a new space station, 100% Chinese space station. So you see that the international context is changing quite rapidly, at least in the 2 next years. Now, what does ESA do in this respect? Jennifer will talk a little bit more later on what we do on the International Space Station, where we will continue using it until the end of the decade. But we are now fully engaged into deep space as well. And this has actually only really started this year. For the moon, and I will go into details a little bit later on, for the moon, we have developed capabilities to access the moon, to circle around the moon with the gateway, and also later on to land on the moon. For Mars, we have a very significant program on robotic Mars exploration. In 3 years from now, we will land the ExoMars rover to search for life. And we have now started also the Earth Return Orbiter and sample return mission, which we hope to start in 2026 with NASA. And I will also talk a little bit more about this later on. So let's zoom a little bit into, for example, the Gateway, which is one of the most important programs we are participating in from now on. The Gateway is actually a kind of a permanent command module, like it has been for the Apollo mission. And the purpose is to be able to land on a very sustainable basis. Crews, for example, two Americans will land hopefully end of 2024, if not 25, on the moon. And later on, these landings will be using the Gateway as an intermediate step. We are participating quite significantly. For example, you see on the left bottom the Orion ESM, which is the European Service Module, which will have the capability to bring the Orion module to the Gateway. And on the Gateway, we have two significant elements I will talk about now. Actually, by providing, for example, the International Habitation Module, we are able to barter with NASA also access for our astronauts to the space station, which will orbit the moon. And this module will be launched in 2026. And we have started this year signing the contract and developing the module. Another significant participation is what is called the Esprit module. This will provide the capabilities for telecommunication, refueling, but also it will provide these windows that you see in the middle. Now, for the moon surface, we have the intention to have an autonomous European capability of landing cargo and payloads and scientific payloads, hopefully by 2028. One peculiarity of this lander is that it is compatible with a landing very close to human landing systems like the Artemis program of NASA, where we would have then a compatibility between landing payloads close to human activities. For the Mars sample return, as I already mentioned, it is a cooperation with NASA. It is the most complex mission, several missions actually, ever imagined. So the first mission has already started last year with the Perseverance rover, which will land early next year. We will participate in this mission quite significantly because we will provide the sample fetch rover on the NASA landing system together with a sample transfer arm. And the biggest participation is the Earth Return Orbiter, which will capture the samples once they are placed in orbit with a small rocket from the sample retrieving lander. And these samples will then be brought back and will land on the Earth's surface in the US by 2031. So a very significant effort, which will bring for the first time samples back from Mars. Now, from the budget point of view, what I just mentioned between the ESM, Orion, the Gateway, and the Mars sample return missions, we have now placed contracts in the order of 2.5 billion this year and also early next year. So you see it's a quite significant effort in this decade. But of course, now that these programs are in full swing in development, we have, of course, to think a little bit even further. And obviously, the horizon goal that we have is to participate significantly in a human Mars mission, which will most probably happen in the 2040s. In the meantime, of course, we have to use fully the moon program, as I just mentioned, with the Gateway and landing systems. And we have to continue to use the ISS and probably also post-ISS infrastructures as well. So each of these destinations will have to be run in parallel. It's not one above the other. But most of all, we think that all this has to make sense in a kind of sustainable economic and bring social values. So this is relatively important. Now the minister has mentioned the fact that, of course, we are in quite difficult times with the COVID situation, economic turmoil, environmental and climate change issues. And because of this changing environment also in our society, the messages about why we do exploration at all are even more important than what we do, which is what I have spoken about up to now. So we have to make a very big effort for the next ministerial conference, which is in 2 years, for the next decision making on the budget and the future programs. We have to have our messages more understandable, and they have to be more relevant to people. And of course, we have to make a bigger effort in making our programs better known to the public. So yeah, I come a little bit closer to the workshop now, because actually the space sector itself and the space industry, who does all what I have mentioned before, is not really the ones who will bring, you know, solutions to the problems that we will face in the next decade. For example, if you imagine, you know, a Mars mission of 3 years without any return possibility in the meantime, we have to solve so many problems in the health sector that the space sector cannot bring these capabilities to us. Therefore, we have to focus also a little bit more on societal impact of what we are doing. Usually what we say is we have a lot of spin-off about the programs we are running, but I think this is not enough. I would actually even like to revert the logic to say we have to support the challenges of daily life, and then we have benefits for the space programs. So it's a little bit of a change in the rationale of what we are doing, which means also that we have to have a more objective-driven science and technology program, because we have objectives. As I mentioned, we want to be part of the first, and at least the first, if not more, missions to Mars, human missions. And therefore, we have to reach out to new sectors. And I think this is exactly what we are doing today with this workshop. So again, we have to have more outcome procurements, which means that we have to ask the right questions to be solved by the scientists and the engineers. And one of the ways to do it is not just to define exactly what we want, because most of the time we don't know the solution. So we have to probably initiate a challenge-based innovation ideas. And I will show you just a few examples of those. Of course, we have a footprint issue, and this is a real problem in space. For example, we could have challenges like dividing by 4 the waste mass, you know, that we upload to that we produce in the ISS, or we have to divide by 2 or even more the food mass upload, because we have to have probably more food produced on the space station in a circular kind of economy. Other very, trivial examples, for example, is that we have a big dust issue, you know, on board the space station, and future also on the Moon and Mars. And these issues are quite in common with things we have in daily life. For the biomedical analytics, we have we do have analytics capabilities on ISS, but these are minor compared to what we will need for a Mars mission, for example. So all in all, we have to open up much more to new ideas, and for this, I think the challenge idea is quite pertinent. Now, what will also change very significantly in the next decade is the way we see exploration. As I have shown, we're now going to the Moon and to Mars. We are now used to the images of the astronauts taken by the astronauts aboard the space station. looking at the Earth, which is only 400 kilometers below. So because Earth is so close to the space station, we have actually a relatively low incentive, to make very big breakthrough for very long duration mission. Once we move to the moon with a gateway in a few years from now, the public will have a very different view, so to say, on Earth, because they will see the Earth like you see it here, taken from the Apollo 8 mission, which means that the consciousness of the environment will be hopefully much bigger, and we will see also that having 4 people survive in the gateway is not the same than on the space station, because it will take them several days to come back and not a few hours, which is the case if there is an emergency currently on the ISS. For Mars, Mars is 1,000 times further away than the moon, and there everything will be very different. So we have to think about completely autonomous systems for 3 years, and this is where the big revolution will be. And honestly, we have to start now looking into these kind of aspects of research, of science and technology, because once the competition between the US and China for Mars missions will start, we have to be ready to be fully part of that, and that will take quite some time, to develop systems and capabilities that will be useful. So just as a conclusion, before Jennifer speaks much more about the scientific aspect of what we're currently doing, especially on the space station and ground research, just as a summary, you see here that from this year onwards, we have now signed these big contracts for the service module to go to the moon, the participation in the gateway, and also the Mars sample return mission. So we're now really shifting in this decade to deep space. And I think this is the important message today. And I think we have a lot to learn from the private industry in the biomedical field to help us to achieve these missions, essentially the big one, which is bringing a few people to the surface of Mars in the 2040s. So thank you very much for your attention.
Thank you very much, Didier, for this very nice overview of ESA exploration program. And as you said, one very important point is to bring space closer to other sectors and to understand what actually other sectors are doing and what other sectors need. Today we have with us Maria João Queiroz, member of the board of ICIP. ICIP is the Clinical Research and Biomedical Innovation Agency at Portugal, who's going to give us an overview of the pharma medical research ecosystem in Portugal. So, Maria João, the floor is yours.
So, good morning. Is everyone seeing me and the presentation in full screen?
Yes, we can see the presentation in full screen.
So then, good morning to everyone. Really thanking you for the invitation to participate in this discussion. What was asked to me was really to give an overview of the biomedical and pharmaceutical research field in Portugal, or a little bit in general. And I have to confess, face to the previous and probably the next presentation, mine will be very low-tech and down-to-earth presentation to give you an overview of what is going on. So we have this relatively new established agency that has really, with its mission, to promote the collaborative research and the innovation in Portugal in the biomedical field. So possible collaborations with microgravity and space research in general are very much in line with what we would like to do. And it's important for us to know more about what we are doing. I will start with the framework, how pharmaceutical or biomedical research really evolves. I don't know if everyone is familiar with that, but I think the concepts are probably important. So the biomedical research and biopharmaceutical research has different stakeholders. Traditional, the biopharmaceutical industry, then the national health system, researchers and academia. More and more also the patient involved, having a say in the designs of the research projects. But as you probably all know, we live in a very regulated world, so the data have all to be approved by the regulators, being the FDA in the US, EMA in Europe, that will assess the efficacy and safety of medicines. And we have now, for some years now, a very active player that is the so-called HTA body, Health Technology Assessment Bodies, that will, the payers, that will assess, and they're very important in Europe, okay, if the compound is useful, effective, safe, but is the society willing to pay for it at the price that the developers think it should be. This has led that we have a very heavy, long-term and very little effective system. And the confluence of the needs of the patients to change this, because it's too long, it's too expensive, with a very poor success rate or little success rate. So even everyone is working into changing this. And we all know that we have in the European Union, the European research agendas that are also very strong in biomedical research, fostering the innovation and the entering of new methodologies, innovative methodologies that will alter all this process. Here I would highlight the Innovative Medicines Initiative, because that is working now for some time, and curiously enough, it has been quite a success. And it is a private-public partnership with a huge amount of funding for pre-competitive research. So this ecosystem with the development of knowledge, technology is really changing. New R&D players are entering into the system. This leads to new models of partnerships, because being this very regulated, very competitive, we have intellectual property issues that had to be solved, but the ecosystem is changing. The model of working that traditional in the pharmaceutical or biopharmaceutical industry was done from early to late phase research very much in-house is moving, and has been moving already, for really externalization. There is too much knowledge, too much expertise that has to be incorporated to be able to do everything in-house. And the technology players from AI, cloud-based platform, cognitive technologies, and 3D digital health solutions are coming in as very strong players. And last but not least, the patients that now have a voice in their own diseases and in the development are moving even further from this and moving to a consumer position, a demanding consumer position. This is probably something that you all know. It's very a traditional stepwise approach for biomedicine to be developed. We go from the basic research concept to drug discovery, prototype development, and the preclinical trials and the clinical trials. And then the approvals by the regulators. And then we have more and more research after approval, especially with data, real-world data, integration of data. This project is not so stepwise anymore. We do go back and forth, incorporating different steps, but we don't have the time to discuss it now. But this still shows the basic flow and steps of the development of a biomedicine. So what is it happening now? When we talk of basic research, the initial target identification and then the drug discovery and prototype development, the very traditional way of doing it. The same way for preclinical trials. We have the in vitro and the in vivo experiment in animals, and then the clinical trials with patients and volunteers. And then we have the approval, and as I said, more and more post-approval activities. So the model at the moment is that, as you can probably see, that the pharma players and the big biotech companies, they work and deal with all the cycle of the project. In the basic research, in the last years, academia and staff have been deeply involved, already buying in their knowledge, and the technology players are playing a huge part in the clinical trials arena. But what is happening already? This is a KPMG slide that shows that actually the invention phase, basic research and prototype development will and is already including identification of new target molecules from central repositories with AI and cognitive technologies, and the testing phase. In general, preclinical and clinical is including more and more technologies like 3D printing and lab on chip. So this means that the technology players, the new ones also are starting to be involved in all the phases of the development chain. And this will make a huge difference in the speeding and in the cost effectiveness in the success of the projects. There is, and we are seeing, although we are in a very, very conservative environment, that has been very difficult or reluctant to open up, but had to be able to incorporate the new fields of technology that are coming in. We are seeing in biomedical research and biopharma research that technology and innovation is accelerated and is conversion. These frontier technologies are leading to a merge of physical, digital, and biological worlds. And cross-sectoral spillovers are generating new fields of expertise and of knowledge that we have to find a way to integrate very quickly into the process to be able to meet the societary needs. So now into the Portuguese ecosystem in a very macro approach for you to know where we stand. So it has been a developing world that has really come to a much more mature and vibrant stage with the interactions of the very well-known research institutes, a good healthcare with very good clinical researchers, and a lively and rapidly developing world of biotechs and medtech companies. Who are the main public bodies? Infarmed is our regulatory agency, part of the EMA regulatory network group. And then we have the social association, the pharma, the medical devices, and the biotechnology. We have also Health Cluster Portugal that aligns all the stakeholders, from companies to hospitals to researchers, and our agency, as I mentioned. The pharmaceutical companies in Portugal, how can we interact, or how can you interact with them? Let's say at the local level, the subsidiaries deal more with the late phase research and the clinical trials implementation. The innovative part, the early stage, and if we can call it incremental or even disruptive research, is done directly decided and led by headquarters. And they are already collaborating significantly with research institutes and academia in specific collaboration models. What the local subsidiaries can do is really bridge and make aware and brand the capabilities in Portugal to the headquarters. The Portuguese pharmaceutical and companies are not very research-driven traditionally, especially with some exceptions like Ovion, that is a really innovative and is a large multinational company, and Bial that has focused on a specific line of research, especially in neurology. The Portuguese biotech have matured, are very active now, and in fields that can be near to the interests and even to working in microgravity. Here, the Portuguese Association of Biotechnology Companies could be a good partner to reach out. The medtech companies has been a very interesting case of success in Portugal. The Portuguese medtech companies developed into two very competitive partners with very qualified human resources, with working in a diversified offering of formats that go from polymers, bio, nanomaterials, metals, and so on. And they are very flexible and very adaptable to different needs of worldwide partners. They're very state-of-the-art workers at the moment. Large multinational device companies like Siemens have been investing a lot in local, in academia and local research institute, in planning for, in doing and implementing very innovative research, and others like Medtronic is investing greatly in partnership with the medtech companies. We have the very well-known and very well-established in basic the research institutes. This is by no far all the logos are not are some selections. They don't represent nothing. Not that they are all of them. Not that they are in grades of importance. They just are examples, and they were traditional, very good in basic research, internationally very innovative, but they have been evolving to collaborate. And even some mergers to create critical mass. And some of them are really very working in very collaborative way with the different cluster for health, textile, biomaterials, engineering, and so on. And I believe here we really have some groups that will be very interesting, also from the contacts I made before, in being able to collaborate, or at least know more about being able to work in a microgravity scenario in different aspects, but stem cells and 3D modeling for sure. Then we have, of course, we are talking about pharma and products. They have to come to the market. So we have the other partners that are the hospital and clinical research investigators. They collaborate in the clinical trial part, the development part, and more and more into translational research with the different research institutes. So just to end this presentation, we see that very much integrated from technology, IT, and technological information and data-driven. We have a model in Portugal now that is very collaborative with the different stakeholders. This has been very, like the minister has said, has been very promoted by the national science agenda and by the needs also that the different stakeholders involved in the process felt. And I think this will be a great opportunity to include and to know more about microgravity and space research that is really somehow being distant from our radar. So thank you very much, and I'm available to ask for you to contact me further on if you have any questions or want specific contacts. Thank you very much.
Thank you very much, Maria João, for your nice presentation. It provided us a very nice overview of the health sector in general and the main players and activities in Portugal. And I believe that with this, we end up the first block, the keynote speeches. And I want to thank you all for all your time here. Actually, it has been very interesting to know the different approaches from the different entities. And now we will move on to our first programmatic topic, which is microgravity for quality of life, research and industrial applications. And just to remember to the audience that you can make questions in the chat, and at the end of the presentations, we'll have some time to answer these questions. So please feel free to make these questions. And now to link together clinical research or biomedical sector and space, we have with us Jennifer Ngoan, who is the Research and Payloads Program Coordinator at the Human and Robotic Exploration Program at ESA, who is going to present us the SciSpace program. So Jennifer, the floor is yours. If you are here, and if not, we will wait until she joins us, because I think that she has had to leave 1 second. Jennifer is connecting again. Jennifer, can you hear us?
Yes, sorry.
Yes. Jennifer, the floor is yours.
Technical problems. Thanks. So my computer froze. So now I'm starting everything from the scratch. I hope you can hear me.
Yes, we can hear you well. Yes, and we can see your video now.
All right. Do you see my slides?
Yes, we can see it in full screen. Thank you.
All right, perfect. So thank you very much for the introduction, which I missed. I'm very honored to be here today, and I look forward to share with you in the next 20 minutes what kind of space research we support, why we support and actually need to do this research, and how you can contribute to our activities. Now, first of all, what do we do? What is our drive, and why is there a need to conduct science and specifically medical research in the space environment? You have probably realized it. Human spaceflight is currently entering the next phase of space exploration, or in other words, the second space age has arrived, and people are looking to space for answers more than ever. Artists are singing about it, entrepreneurs are investing in it, and scientists are relying on it to predict the future of our planet. And almost every day, studies on astrophysics, astrobiology, and space physiology are published in major scientific journals and often make the news headlines. And by the way, quite a few Nobel Prizes this and last year were related to space sciences. Also, you might have heard or read in the media that all major space agencies, including us from ESA, from the European Space Agency, we would like to go back to the moon. We would like to go back there, not just for brief visits like in the Apollo program 50 years ago, but this time we would like to stay and work and live up there safely and sustainably. But we do not want to go back to the moon for the pure sake of returning. We would like to go back there to prepare and be ready for even more challenging missions. Ultimately, we would like to be able to go to Mars with a human crew for extended periods of time. I know all those plans sound really ambitious, we know, and they are indeed ambitious. And we also know that if we want to pursue those plans seriously, we really need to understand the combined effects that deep space and the deep space environment have on our astronaut crews, on their health and performance, and ultimately mission success. As of today, you probably know, only 24 astronauts as part of the Apollo program have been in deep space, and only for a maximum of 12 days. And as of today, there has not yet been a single astronaut who stayed in space for the total amount of time that is needed for a full mission to Mars and back. Even if we add the total time in space for those astronauts who were lucky enough to be sent into space multiple times, only very few astronauts reach that level today. And let's be honest, once an astronaut crew will have completed the roughly 9-month long journey to Mars, there is considerable risk that they will not be fit enough to carry out all the tasks that they were trained and launched for unless effective preventive measures are developed. So that means that we have an obligation to ensure that our astronaut crew members remain healthy and are able to perform their complex tasks, which is why we have to address as many, if not even all, the risks and challenges that go along with such missions, and try to identify how to prevent or counteract those risks and challenges if we want to make a mission out of the vision of going to Moon and Mars for extended periods of time. And that is what we do with our daily work. Now, what are those risks and challenges? It will for sure not come as a surprise to you when I tell you that the space environment does not offer conditions for which we humans were made for. Space is actually quite a hostile and unforgiving environment for humans when you think about it. Space exposes the astronauts to massive radiation. The crews have to live autonomously in isolation and in a pressurized aluminum can in which noise, vibration, temperature, atmospheric quality, and other aspects of the surroundings are generally less than ideal. Space also exposes astronauts to zero gravity conditions, which has an impact on their bodies. And just to illustrate which effects space flight has on the human body, a 6-month stay in orbit reduces bone density by the equivalent of 10 years on Earth. It reduces physical work capacity by 40%, and it exposes astronauts to increased cosmic radiation, which leads to an increased risk for cancer. So all those very extreme conditions have a direct impact on the feasibility and the success of such long duration crewed exploration missions that we are currently planning towards. And those extreme conditions are what we address with all our research activities. So all the activities that we support through our program center around one central question. How can we make humans a spacefaring species? In other words, how can we contribute to make missions beyond low Earth orbit with a human crew a safe reality? And how can we preserve health over the entire lifetime of our crew members? Within our program, we make use of various unique facilities and platforms, both in space but also on ground. Each of them addresses and reproduces one or more unique features that are characteristic and challenges that the space environment has on us and the human body. And I will depict just how our various research activities ultimately all fit together. So I will take you onto a tour through our very diverse and interesting research activities on the research platforms that are part of our program. I will start on ground and move slowly out into deep space. Now, do you actually realize that we do not need to send astronauts to space in order to study how humans, how systems adapt to the space environment? We can actually do a lot of space research without having to leave Earth, without actually having to go into space. And that is one of the strong elements of our program and distinguishes us from our international partners. We offer complementary ground-based space analog research platforms to our science community, in which we simulate certain conditions that are characteristic for the space environment. For example, we can simulate microgravity effect here on Earth, and we can do that in bed rest studies. Bed rest studies are a very well-established model to study the effects of long duration inactivity or disuse of muscles. So volunteers who agree to participate to our studies spend up to 60 days in bed, tilted towards the head end. And by doing so, the bodies of the volunteers start to adapt as if they were in space, allowing us to mimic and study some aspects of space travel. Bed rest studies are therefore a very valuable tool for simulating the effects of space flight on the human body. And we from ESA, we actually have a very long history of conducting bed rest studies. But what do we actually gain from reproducing those effects? What is the point of making those poor volunteers suffer? Well, we made use of the effects of bed rest on the volunteers to test promising countermeasures. We have tested a lot of different countermeasures in the past. We've tested clever exercise devices that can be used in bed. We gave the volunteers drugs, special nutrition, but none of those countermeasures have provided us yet with the ultimate solution to counteract the effect of weightlessness on the human body. So the hunt for the perfect, most efficient countermeasure continues. So let's make this meeting a bit interactive. What do you think is the simplest way to counteract the effect of zero gravity on the human body? I will pause for a few seconds. You can use the chat box to provide answers. Well, actually, I don't see the chat box since I'm now presenting slides, but okay. The attentive participants, of course, notice that the answer is already on the slide. We take gravity with us. Of course, that is not that simple, but we do have tools to create gravity. We can create artificial gravity. Artificial gravity is perhaps the most promising, but interestingly enough, the least studied method for countering the physiological effects of human spaceflight. Of course, artificial gravity cannot solve the critical problems that are associated with, for example, radiation exposure, isolation, and confinement, but it has the potential to reproduce Earth-like gravity and therefore to reduce the effects of microgravity on the entire human body. We recently put in place a new bed rest study plan focusing on artificial gravity as the main countermeasure that will guide our activities in the years to come. The idea is that we would like to prescribe gravity like a drug, giving it in short but large enough doses through so-called short-arm human centrifuges, in isolation, but also in combination with specific exercise devices that will be mounted onto those centrifuges. We're currently in full swing modifying our short-arm human centrifuges for those future studies, and we will start with the first study next year. In addition to the traditional bed rest studies, we're currently preparing for the implementation and validation of so-called dry immersion studies. During dry immersion, weightlessness is reproduced by having volunteers suspend or float freely in water. They're protected by a fabric so that the volunteers do not get wet, which explains the name dry immersion. And that entire setup is hypothesized to lead to faithful reproduction of most effects that microgravity has on the human body, like, for example, centralization of body fluids, unloading, and disuse of muscles. Preparations for our first dry immersion studies and their validation have started.
One second, I think that we have lost Jennifer. She will be joining us right now to continue with her presentation. Let's wait one more minute, please. Here you are, Jennifer.
Yes. Where did I lose you?
You were actually presenting in the beginning, if I'm not mistaken, of the dry immersion studies, I think, and we lost you there because it froze.
Okay. All right. So yeah. So dry immersion, we have started to implement, and if that model proves to be efficient and effective, we will continue that study model also in the future. You now see the slide with the Concordia Research Station?
Yes, we can see it.
All right, perfect. So apologies for that hiccup. I don't know what happened here. So while we also support research on the Antarctic continent, specifically on the French-Italian Concordia Station. Why are we convinced that research on Concordia Station is valuable for us and for our program? To put it simple, you can essentially look at Concordia Station as an ISS that was dropped in the middle of the Antarctic continent. Concordia Station is one of only 3 research stations on the Antarctic continent that are permanently occupied throughout the entire year.
I'm afraid that we have lost Jennifer again. This is not easy today. Perhaps what we can do, let me check with the technical team 1 second, and I will go back to you. Okay. Apologies, everyone, for this technical problem. What we will do is that we will move with the next presentation, which is from Sener, and then Isa can explain the other part of the presentation at the end of this panel. So now we have with us Joan Manuel Casalta, Director of Scientific Program at Seminário Espacial, that will present us Sener's experience in developing microgravity payloads. So Manuel Casalta, the floor is yours.
Muito obrigado, Joan. Bom dia. Thanks for the invitation to participate in this interesting workshop. As you said, my intention today is to present through our experience, through our projects, the lessons learned and the conclusions of some microgravity facilities projects already done, and maybe I think that could be useful for you in the next future to participate in this interesting program. Let me share my screen. Can you see now?
Yes, we can see now. It's full screen, yes.
Okay. So, well, let me introduce about our company with just one slide. Seminário Espacial is a private Spanish engineering company with a really long experience in space. So it's really a good example of a good participation in several programs. Sener is known, as you can see here, to provide mechatronic systems. So we have mechanisms, for example, now in Curiosity rover in Mars, but we have participated in several missions, especially with ESA in the science program, but also in a observation program, mainly in several programs. Recently, we have started, well, from some years ago, our knowledge and participation in optical payloads and instrumentation. As you can see, we have provided the primary payload for the Earth observation. That's the first Spanish satellite for Earth observation. And one important thing that also could be useful for you, we have participated in several instrumentation with the science team in Spain through the national program that also give us a lot of experience in instrumentation and mechanisms for this part of the payloads. Our experience is not limited to optical and mechatronic systems. Also, we have an interesting group to provide GNC and OCS systems. So we provided the OCS for Planck satellite. And now we are leading a mission, a complete mission for ESA that is called PROBA3, that the purpose is to demonstrate flight information for satellites that hopefully will be really interesting on future missions. Last but not least, last year we incorporate in Scenario Aeroespacial the TRIO group. The TRIO is a totally different product. It's based on communication systems. So we are now capable to deliver complete communication systems. And a good examples are the antennas we deliver for Solar Orbiter or now for JUICE mission, already together with Active Space Technologies, a Portuguese company that also is helping us in several projects. But we also are capable to deliver components and antennas for the commercial space market. That is another interesting purpose. So let me go through the experience. I see in the audience people talking about shuttle Columbia, so it's nice also for us. We started our participation in microgravity a long time ago, what we say our white line. So we deliver freezers. So freezers were delivered for the shuttle Columbia for different testing purposes, but also the Mir space station and even the shuttle Atlantis in the space hub. So it's the different type of hardware that allow us to start in this interesting but different field in the space and allow us to have a really good experience on that. After that, we were capable to provide the freezer units for the Columbus biolab module. So it's one of the modules on the European module, Columbus. And there we delivered the ATCS, the automatic temperature control storage, and TCU. TCU is a unit that has been working on the space since 2008, or approximately, but now today is still being using to have samples inside and have at low temperature. Here, and maybe in different projects, I will go on the project conclusions in order to give you some idea. Here for us, the main difficulties on the first time to achieve really complex specifications. Here we have electronics, mechanics, but we should understand how the hardware will work. We look for reliable subcontractors. On that time, nobody makes carbon fiber, or really low companies make carbon fiber. We go to Ferrari, and Ferrari, the part for Ferrari with good experience in carbon fiber supplies us the structure of the unit and really help us to get that. We were able to set up and continue, according to our experience, some good team, but the team experience in microgravity. And we learned about some peculiarities in microgravity, like could be thermal convection, that allow us that a freezer that only work at -5 degrees in ground could work at -20 degrees in the orbit. So has been really successful and nice project and already doing some work. The second point is a total different project because, well, it's another good example, but a simple project. This is issued by a Spanish scientist. The project is called Granada Crystallization Facility. The scientist, of course, is from Granada, and he has a good technology in ground to make protein crystallization experiments. So the idea is to bring this protein crystallization process to the space in order to have better crystals mainly for the pharma industry. And well, this has been really successful project because we make a simple box that fly with several missions. One, for example, Cervantes mission from Spain with Spanish participation, but also with JAXA, that they get the hardware and use it in several missions in order to produce these crystals. The hardware did not stop here. We realized that the temperature may affect the system, and we make a new facility to control the temperature inside. And this facility flow with photon M3, that it's a capsule specific for these experiments. That could be also a good experience, for example, a good example for you for the space ride, where you can put a payload like that to do these specific experiments, and you can have or science or industry results for that. The next one is really a complex facility. Jennifer should pretty know about it. It's called MARES. It's MARES. The purpose is an instrument to measure the muscle atrophy that the astronauts suffer in orbit. So as I said, it's a complex facility. You can see here some pictures of the different strains. A picture of the Thomas Pesquet on the Columbus module, restrained to the machine. So here our first main trouble was to limit payload complexity from initial scientific requirements. I know now ESA is doing this work previous to the call for tender, reviewing science specifications. That is good in order not to get really a much complex machine. Well, here you can imagine when you restrain an astronaut to a machine or a motor that can make 1 kilonewton and break everything, the need of safety and human factors knowledge in order to to be sure that the machine will work properly as it works, and to defend in front of ESA and NASA about this the possibility of this flight. Here another difficulty is that the astronaut is the person who has to set up the experiment, but also the experiment itself. So the number of hours needed to do that were important. So now, as the experiment already finished in orbit, we have these machines in Russia, in DLR, or in France, where the astronauts can do the exercise before and after going to space, and also get science from that. And for me, the most interesting and important conclusion is that our CNR MARES team was able, after that, to produce a lot of hardware. So the knowledge of this team was really important, and it really appreciated a company like us, and they can make really complex systems for healthcare or even science. We're participating in ELT or fusion market, and they are also able to transfer this knowledge, not the technology, but the knowledge to different markets. And it's also interesting for getting this experience. The next one, it's different, also this small project. This is launched by the technology group in ESA. And the purpose was to detect ammonium in a recycled water loop in the space environment. So here we don't have in our hands the technology, and the point is we go to the key technology people. So we made this project with the group of sensors of Universidad Autónoma de Barcelona. I see Julián Alonso around the participants, but also with the Universidad do Porto, the SETA group, Requinte, with the Professor Costalima and Alberto Araujo. So they provide to us the needed technology in order to detect ammonium in a small hardware. You can see here some image compared to 1 euro. And with that, we could solve the needed from ESA in order to solve the detection of this ammonium inside water. So my conclusion here is that, okay, you can get really good technology transfer, knowledge from research community participating inside your project or leading themselves. And here the industry or the knowledge has to validate prototypes in the specific real environment. This could work on ground, but it's not still demonstrated that could work in the space because the microgravity conditions can affect the detection of the ammonia. So we stopped this at the level of technology at TRL 3, but TRL 4. But the next point is how we can apply this technology for future manned flights or for future water cycling. So hopefully we can do it in the future. The next one is one of our last projects, but it's also seems simple, but I want to insist that are not simple projects. In that case, we get a experiment from NASA that they were demonstrating the seeding growth, plant growth in the space. And our purpose is to stop this growth to frozen by means of injection of formaldehyde and stop the experiment and bring the samples to ground in order to analyze in a laboratory and see how the DNA and everything has changed. So in that case, we offer our capabilities to the scientist groups. It was led by the SIG, but also using as an AIMS experiment. Here, the safety aspects are complex because you can imagine that that we can inject formaldehyde in a closed environment like the ISS, and we need 3 independent levels of containment. So that is not easy to design a payload to do that. And also we should cover everything during the mission: preparation, launch, and experiment and return. Now maybe Jennifer will talk about it, but you have some facilities in the ISS where you can do specific experiments to do that. So no need a specific payload. And last but not least, in my 10 minutes presentation, it's about Melissa project. In fact, this week has been really an interesting workshop about Melissa opportunities and also experiences. So Melissa aims to study a circular life support system in order to produce food, water, and oxygen from mission waste. So it's an interesting project for future habitat missions to Moon or to Mars in order to save mass and money, especially to have and produce this food and water. Here, the key point is that there is a pilot plan in Barcelona with the participation of several countries. In this pilot plan, you can learn a lot, but also can take some technology to make space demonstrators. I'll talk in the second line. But also, one of the key points I learned this week is that this technology developed, thinking in space, is being applied in several aspects on our daily life. So you can have great water systems, also, as Jennifer was talking about Concordia, but they apply in hotels and different places, or you can build green buildings using this technology. Also, Didier really has an important role in this workshop, and congratulations for that. But here, another point is that not only space industries participating in this pilot plan, also several standard industries have really special knowledge, they can participate. So this is a good example of a tractor project that also you can think in Portugal, and you can use with your space and industry in order to set up this type of projects and learn and have this transfer of technology. Okay, so there is nothing else. Thanks muito obrigado for your attention, and I will be happy to answer any of your questions. Thank you very much.
Thank you, Joan, for providing us actually this industrial approach to microgravity research and how you develop payloads. It's very good to see that industry also gets involved in microgravity scientific research. And now, without further delay, we'll continue with Jennifer's presentation, and the technical team will share the screen.
Thank you.
Yes, thank you very much to the team. Thank you for your patience, and I really apologize for this internet hiccup. I think we stopped at Concordia Station. So Concordia Station, just to summarize that slide, allows us to use results from mainly human research experiments to extrapolate for missions into deep space with human crews. We are planning to release a new announcement of opportunity for new research next year. So if you are interested in participating to this very unique research platform, you can already now start to think about nice projects. Next slide, please. We also support, next slide, please. Yeah, thank you. We also support artificially induced isolation and confinement studies. So our Russian friends have started last year the so-called Serious Isolation Program, which is a program where crewed, increasingly complex missions to the moon are simulated, which matches perfectly the global exploration plans that Didier showed you at the very beginning of the talk. In addition, we're also preparing to launch our own ESA-led isolation studies here in Europe within the next 2 years. So with the last 3 activities that I mentioned, we look at what isolation and confinement does to humans from a psychological point of view, and we try to identify countermeasure or coping strategies. Next slide, please. Another challenge that we need to address when thinking about long duration exploration missions with human crews is radiation. Actually, the most dangerous aspect of traveling to Mars is space radiation. Astronauts on board the International Space Station are still quite protected from space radiation because the space station sits just within Earth's protective magnetic field. And even though our ISS astronauts are exposed to 10 times higher radiation than here on Earth, they're still much less than the radiation levels that they will encounter during a mission to Mars, and of a different type. Unfortunately, up until now, we do not yet have good practical and efficient countermeasures or radiation protection strategies available. And that is why we make use of a couple of ground-based radiation facilities, which we use within our space radiation program called EBER, to advance our knowledge in that field. So through that program, we test good practical shielding materials and try to identify pharmacologic or dietary countermeasures for protecting the human body against radiation-induced toxicities. So that is another platform that helps us to prepare for future human exploration missions without having to leave Earth. Next slide, please. Let me now move a bit closer to space, to our very popular parabolic flight platform, which is our scientific bridge to the International Space Station. We can use parabolic flights to test the effect of microgravity on fast adapting organ systems. Parabolic flights are therefore a very valuable tool for us to look into microgravity effects on, for example, the neurovestibular system. For our parabolic flight campaigns, we now make use of a specially configured A310 aircraft. That plane was certified 3 years ago to fly parabolas that provide also partial gravity levels in addition to microgravity levels if needed. So we can now fly, for example, gravity levels that correspond to lunar or Martian gravity levels. We've done so in a special campaign that took place 2 years ago. And we will actually have another such partial gravity campaign later this month. Let me move 1 floor up. Next slide, please, to the International Space Station, or ISS. The ISS is the most prominent and most innovative research laboratory that I'm sure that you all know. The ISS is the most complex research platform that mankind has ever made, and we can be very proud to be part of this greatest international project ever. This week, we're actually celebrating 20 years of permanently crewed ISS. And with that, the ISS is the only and longest running international microgravity research platform ever sustained in human history. Since assembly was completed in 2011, a very productive research program has been implemented that has continuously grown and will continue to deliver unique results until the end of lifetime of ISS. Next slide, please. Our human research program on board the ISS covers all body systems that are affected by the space environment. For example, we study the muscle system of our crew members. Because astronauts work in a weightless environment, very little muscle force is needed to move around. And as a result, their muscles atrophy and deteriorate in function. We all know that without regular use and exercise, muscles become weak and melt down. So that is something we really need to counteract against. We also know that weightlessness affects the sensory motor system. You've probably noticed that all astronauts experience balance problems immediately after landing. That is a huge concern because once astronauts land on, for example, Mars, one of the key questions is how long after landing will it take the astronauts to recover? And will they be able to perform the required mission tasks? How long will it take them for their hand-eye coordination to be up to normal levels? You can see under the last bullet, the visual impairment intracranial pressure syndrome, or spaceflight associated neuroocular syndrome, as it is called nowadays. It has been known since space shuttle missions that astronauts get long-sighted, which has even led to flight surgeons sending along extra pairs of glasses. Why this syndrome occurs and what we can do about it is the topic of intense research. So these are just some of the questions that we address with our human research program on board the ISS. There are many more. Those were just few highlights. Let me mention also for completeness the other research disciplines that we do on board the ISS. Next slide, please. For example, our biology experiments. Thank you. So we do a lot of biology experiments. We examine how plants and animals grow, develop, and mature. Next slide, please. And then also our activities cover physical sciences research, where we look at how materials behave and perform in the space environment with the vision of finding or creating new novel materials. Now, I took you through a tour through our various research opportunities, starting on ground, continuing in low Earth orbit. Let me now move beyond low Earth orbit into the vicinity of the moon, or to be more specific, to the Lunar Orbital Platform Gateway, which has also been dubbed simply as the Gateway. Next slide, please. So what is the Gateway? As you already heard from my colleague Didier, the Gateway is going to be a moon orbiting research platform. So with the Gateway, we will extend human presence 1,000 times farther into space compared to today's International Space Station. I told you earlier already, all major space agencies are preparing to put astronauts on the lunar surface within the Artemis program. But contrary to what was done 50 years ago within the Apollo program, this time astronauts will first dock with the Gateway before boarding a lander that will carry them all the way down to the moon. So you can look at Gateway like a cabin that sits high up on a mountain. The Gateway will provide shelter and a place to stock up on supplies for astronauts who are en route to more distant destinations. The Gateway will also offer a place to relay communications and can act as a base for scientific research for up to 90 days at a time. Next slide, please. You can here see the latest planning that was released earlier this year by our NASA colleagues. I know it's a very full slide, but in short, what you can see is that the first uncrewed mission of the ambitious Gateway program is planned for next year, so 2021. The first hardware piece of Gateway is scheduled to launch in 2022. And then in 2023, NASA plans to launch the habitation module, which will serve as crew quarters for future astronauts who go to Gateway. And once all those pieces are put together in orbit, we will have an infrastructure in place that we need to send astronauts to the lunar surface. And we plan to send the first astronauts to the lunar surface by 2024. Next slide, please. To translate that very full slide into something very simple, we currently foresee two phases of Gateway utilization. So phase one is the initial construction or build-up phase, which of course goes along with limited crew time and limited resources for research. But we will be able to have, we will be able to do more as of phase two, where we expect and prepare for increased research capabilities, increased crew time, and the possibility to return samples from there. Next slide, please. We from ESA, we already held community science workshops for the Gateway. There's tremendous enthusiasm for the Gateway project in the community because it's a real opportunity to do the kind of science that has not been able or possible before. The location of Gateway is very different from that of the ISS. It has a very special orbit and environment, and that will provide unique opportunities for science. You can see on this slide some of our focus areas. And in addition, having Gateway where it will be will enable lunar surface exploration with robots and humans working alongside each other. We know the opportunities on Gateway are limited, and we will probably be faced with even more constraints than already on board the ISS, but it is a unique and once-in-a-lifetime opportunity, and the coming time is very important for shaping our role in this international space exploration endeavor. So you see, we have exciting times ahead of us. Next slide, last slide actually. And let me repeat what I already mentioned at the very beginning of the talk. We are entering a new era of space exploration. So one change is that we can already see an evolution from government-led space programs towards a commercial private space industry. Earlier this year, Elon Musk's SpaceX company managed to send US astronauts to the ISS after a long dry spell of several years, and there are many more companies lining up to do so. In the future, those companies will not only send our typical very healthy astronauts to the ISS, but the commercial private space industry will also lead to a change in the population that go into space, which stretches the envelope of whom we send into space, away from relatively young, top-fit, superhuman astronaut crews to health-wise more average, more middle-aged people. We all know that millionaires typically do not lead a very healthy life. The other change is our perspective. We will continue to use low Earth orbit for research and for demonstrating technology, but our vision is firmly set on Moon and on Mars. I admit, missions to Moon and Mars with human crews continue to sound like stuff from science fiction, but we will go to Mars within the next century. Of that, I'm sure. And the success of those deep space exploration missions will, to a large degree, depend on new generations of scientists and engineers and new technologies and developments, like personalized medicine or pharmacology. And if we do it right, we could end up with personalized countermeasure packages which increase the safety and the performance and ultimately mission success of our individual astronauts as they explore deep space. I hope you share our passion for this fascinating program. We humans, we may not have evolved for life in orbit, but learning to live up there helps us a lot in learning about how to stay healthy here on Earth, and improves also many processes in daily life. I'm a physician myself. I really hope that one day your research conducted around the globe, along with our research, leads to longer, happier, and healthier lives for all of us here on Earth. And with that, I would like to thank you very much for your attention. Thanks for the technical team to help me out. And I'm available for questions if you have any. Thank you.
Thank you very much, Jennifer, for your nice and comprehensive presentation on all the platforms that ESA offers. I believe that we'll hear more about commercialization of space activities in the afternoon, so stay tuned in the afternoon session that ESA and commercial players will explain better what they do in space. And now we will move on to some activities that are being done in Portugal by MIT Portugal. And today we have with us Ligia Fonseca, that's gonna present us let's check here, the research project that they did, which is called Applications of Effect of Microgravity on Microbial Chlorophyll for Future Crewed Missions and Space Colonization. Ligia, the floor is yours.
Thank you very much for your kind introduction. And also I would like to thank the previous speakers for the very educational talks. So let me, so sound is good and the image is good, right?
Yes, we can see the presentation and we can hear you.
Okay, so let's go. Yes, today I'm going to talk about a practical example on how programs such as the ones that Jennifer talked about, like the parabolic flights, can be used as for future applications in life support systems, astrobiology, and planetary protection. So the case I bring to you today is the project I co-led called The Effect of Microgravity on Microbial Chlorophyll, and I'm going to speak how it can have applications for future crewed missions, and also space colonization. So let me just start by saying that for humans to survive in space more than 6 months in a row, so besides needing to be shielded from radiation and all the other problems that also Jennifer talked about, we also need a bioregenerative life support system. So there is the need of a sustainable system that keep humans alive in space, that will give them recycled oxygen, water, and that will produce biomass for food. And as a biologist, and I think that's unanimously said by all biologists, there is no way we can achieve that without photosynthesis. And that's because photosynthesis is already the base of our food web here on Earth. So we better try to mimic that also for space. So obviously the main photosynthetic organism we use here on Earth for our food are plants, but there are challenges that need to be overcome for this to be a reality, because photosynthetic organisms, they prefer Earth. They are from Earth, and they will also suffer in the drastic environment of space. And we don't need them only to survive. The problem is this one. They don't need just to survive. They need to thrive. So they are at their best efficiency to produce the resources we need. And so they need to be robust. They need to overcome the microgravity effects, which we know exist, but we still don't understand what effects those are, because of the last 40 years of experiments done in plants in space. What we saw, and in the last decade with gene expression also results, is that there are an overexpression in genes in plants under microgravity. We just don't know what those genes do. Most of them, because here on Earth, they are not overexpressed in plants. They don't need them as much here on Earth. And so we never took time and effort to really understand their function. So this is something that needs to be worked on. Also radiation, temperature, because plants use the usual models that are used for space are mesophilic, and that will require a lot of energy to maintain the moderate temperatures, and they need to be nutritious. So if we do a cooperation between plants and algae, microalgae, we already are in the path of solving some of these challenges, because microalgae, because they are microorganisms, are much more robust, and that's because they are easy and fast to culture as well. So if some of them die, there is actually no big problem, because they will be very easy and fast to reculture the missing part. And that does not happen with plants. As you know, plants take time to grow again. And also the most models that are used of microalgae for space, which are chlorella and spirulina, are already used here on Earth as superfoods to complement our nutrition. So these are also nice complements for space, for astronauts in space, their nutrition in space. So of course, as has been said, there are life support system projects such as Melissa by the European Space Agency, and they are already implementing a dual approach between plants and microalgae. And that is why we still need to keep on finding new models such as chlorella and spirulina, but maybe similar organisms of other similar organisms that come from extreme environments that are already resistant to extreme dryness, extreme radiation, and extreme temperature. Also because when we study new models, we are in a good path to find the gene functions that we still don't know regarding the microgravity effect. And why is microgravity such a big issue? It's because wherever we may want to go to do a colony or a space research station, or to find evidence of life here in our solar system, there will be a microgravity environment. And although Jennifer said there are, of course, experiments to try to mitigate the effect, the fact is we cannot shield it. And there's going to be always going to be that issue to overcome, and we need to understand the real effect, the long-term effect of microgravity in humans and in their food. So there are tools to study that here on Earth. We can use Earth analogs, which are places on Earth that mimic the space environment in any way. For instance, the Arctic mimics extreme dryness, low temperature, extreme radiation. And also we have space simulations, such as the ones that Jennifer presented. We have the parabolic flights, the orbital flights, Mars chambers, centrifuges. Also, we have the ISS and space missions, but those are very exclusive experiments, and there's a lot of homework we can do still here on Earth before narrowing down what are the best experiments to try in space, and also maybe helping us getting new data to always also try to save our own planet. So that's what we did. We combined Earth analogs and space simulations, more specifically a parabolic flight. And we did that by first winning the MIT Portugal competition that granted us a spot, a payload spot on the New Shepard's rocket by the Blue Origin. This was the first competition held by the MIT Portugal. So we were the pilot team. This rocket was very special because it would grant us 3 minutes of zero gravity. So we built the experiment around that. We designed the experiment around that. Another interesting fact is that this competition was only for grad students. So it was co-led by Manuel, Jeremy, and I. And it's called The Effect of Microgravity on Microbial Chlorophyll. We were very interested in microbial chlorophyll organisms. And so first to design the experiment, we went to the Arctic to get organisms similar to chlorella and cyanobacterial spirulina, but that were already very resistant to other stresses. We were trying to use evolution in our favor here, and so we got those organisms from ice cores. They were surviving in ice, and also we got an heterotrophic strain that you can see here below that was also from ice, and we used it as a control for photosynthesis. And so the experiment was quite simple. Here we cultured the eukaryotic microalgae. Here we cultured the cyanobacteria, the heterotrophic was here. And we did that in quadruplicate for statistical significance. And then we doubled everything for the dark control. And we had an extra plate, just as this one, for the ground control. And our questions that we wanted to have answered were if microgravity has a drastic effect in photosynthesis in these Arctic microorganisms. And also we wanted to know how the microgravity effect compared between the cyanobacteria and the eukaryotic microalgae. So with this experiment, we wanted to gain data that would help in future overcome challenges such as knowing the real effect of microgravity, because we are using different models, and also to understand if the stress response that these already very resistant organisms use for microgravity is the same general stress response they already use to resist living in the ice in the Arctic, or if it's a completely different one, and we may find those genes after all. Also, because as scientists, sometimes instead of solutions, we come up with new questions. We were not happy with the robustness being already solved. And so we decided to add another question. Sure, algae are more robust than plants, but between the microalgae, which one is more robust? Should we continue with the spirulina, or should we try the eukaryotic microalgae instead? So the plate went on board of the New Shepard. The flight profile would give us the 3 minutes of zero gravity, and then would return to us. These are real images of the day of the flight. The payload was here with our microalgae, and then it landed successfully. So the positive tools that we wanted to use and are going to use are RNA expression tools, and also, if we are lucky, a bit of the metabolism analysis. Besides the life support system, and other applications could be astrobiology and planetary protection. I can say that I can talk about that very briefly. Astrobiology, because if we are to find life on the icy moons of Jupiter and Saturn or in Mars, we are going to find life that is dry resistant, low temperature resistant, radiation resistant, and microgravity resistant. So we have already organisms like that here on Earth. Of course, not at the extent that they're going to find there, but it's a good start for us to understand what type of signatures we should look for. And also for planetary protection, because remember the heterotroph that we sent as a control, it's actually very closely related taxonomically to the bacteria already found in ESA and as the clean rooms. And so in the imminence of the future decades that are going to be filled with incredible missions, hopefully for habitable planets, we need to be very careful to know how to identify these superbugs, culture them successfully, and know how to eliminate them so they don't go and contaminate the other future habitable planets that we may find or explore. So as any biological space research, we are a multidisciplinary team. So the leaders were the students, but we had guidance from experts. So these are my 3 supervisors of my PhD that also guide me. And we had excellent other collaborators in RNA expertise, with algae expertise, polar scientists, chemists, biologists. And this was a multi-local endeavor. So we were operating in Portugal, in Canada, in the US. We were working remotely before it was cool and fashionable. And if you want to know more about the project, just Google MIT Portugal Blue Origin, and there's a video that you can watch. And I would, I thank you for the opportunity of presenting, and I would be glad to answer to any question. Thank you.
Thank you very much, Ligia, actually, for explaining us your project and your research in this field. And now we have a very short Q&A session because we are running out a bit late. But there was already one question here in the chat that I want to address to Sener and also perhaps to Isa, because maybe you can also talk more about this topic. And there's a question from Denise that was asking Sener if you could mention a bit about your experience with sounding rocket microgravity payload. And I think that maybe Sener can explain this a bit better, and also Isa, because Jennifer didn't go into detail about this, and maybe you can provide more information on it. Thank you.
Yeah, thank you, Joan, and thanks for the question. Well, our main experience has been in platforms like ISS, or as I have said, Photon M3. The question is that our experiments need some time in microgravity conditions, so biological experiments like the mean plant development or even proteins crystallization need minimum some days, and that's the reason that we use other type of platforms. But I remember on the past for physical science, and here maybe Jennifer could explain better than me, that we use for a combustion chamber, we use a sounding rocket. So for different type of experiments, I understand it's really a more access platform and easy to set up with less risk than a manned flight.
Thank you, Jennifer. I don't know if you're here. Yes. Could you please tell us a bit more about sounding rockets and what actually they provide?
Yes. Yeah, I actually did not mention sounding rockets because we were running short in time and I was focusing on medical research. But indeed, another platform where we can do microgravity research while staying on Earth is via sounding rockets. We from ESA, we have been using sounding rockets since 1982 to implement space-relevant research within our program. We can make use of 2 different rocket configurations. The smaller rockets can carry up to 260 kilograms of scientific payloads and offer up to 9 minutes of microgravity, whereas the bigger rockets can carry up to 485 kilograms of payload and offer up to 13 minutes of microgravity. All our sounding rocket missions launch from S-range in Kiruna, which allows us safe and reliable land recovery of the scientific payloads, and also simplifies the reuse and refurbishment of hardware for next missions. The mechanism to participate in sounding rockets is very simple. You submit a proposal to the dedicated sounding rocket research announcement. You can find it on our research announcements website. Those proposals that pass the scientific merit and the technical feasibility review enter our pool of experiments, and they are then implemented for they are then prepared for implementation at the very next opportunity. So the 2 next sounding rocket missions that we plan 4 are already full. They're filled with scientific experiments. But as of 2022 to 2023, we will have more slots for sounding rocket experiments. And for those slots, you can still submit research proposals.
Okay, thank you, Jennifer. So what I understand is that for the batch of 2022-2023, there are still slots and sounding rockets, and researchers can submit their proposals. And I also have a question for Legia, and you have explained us this very interesting project. And perhaps I want to ask you, what are the next steps? Do you plan to continue developing ideas in this topic and using microgravity? Could you tell us a bit more about this?
Yeah, so we need to continue with the post-flight tools and experiments, and that will, as always, generate more questions for sure, because we are in a very unknown ground here. We are testing Arctic strains and the microgravity infecting them, and there are not much known yet. So depending on the results, we are then continuing, hopefully, and I will be finishing the PhD, and hopefully also as a postdoc, I can do also that. So let's see, it will depend.
Okay, so thank you all the panelists, Jennifer, Legia, and Joan, for being here with us today. Now we'll do a short break, and we'll continue at midday sharp with pharmaceutical and medical applications. So please stay tuned with us.
Thank you.
Okay, and now it's working. So welcome back to our third block of the day, the last one in the morning session of our Microgravidade workshop. To recap what we have been discussing in this morning, we had a first block where different institutions in Portugal, the Ministry of Science, Portugal Space, ESA, and ICIP presented a bit the institutional overview on the space sector, Portuguese government supporting these initiatives and the medical research. Then we had a second block, very interesting one, where ESA presented the SciSpace program, and we also got some industrial insight from CENER and from MIT Portugal. And now this block, this third block, it's devoted to microgravity for human research, and we will be talking now about pharmaceutical and medical applications. And for this, today we have 4 panelists from different backgrounds. And we will start with Thais Rusumano from the Faculty of Medicine of the University of Lisbon, who will tell us a bit about medical research and challenges. Then we'll hear about Puneet Tyagi from AstraZeneca and pharmaceutical applications. And then we will also listen to Markus Wieland from Otto von Guericke University, a research center in Germany. And finally, Space Pharma will provide us an overview of the platforms that they have to provide access to microgravity research. So without further delay, we will move on now with the first presentation from Thais. Thais is working in the Faculty of Medicine at Universidade de Lisboa, and is a professor with a lot of experience in this field, and her presentation is called Human Space Exploration, Challenges and Achievement. Thais, the floor is yours.
Thank you very much for the introduction. I will share my slides. Okay, here we go. Can you see my slides? Just say.
Yes, we can see the slides, and now it's full screen. Yes.
Okay, it's full screen. Great. So I'll thank you very much for the invitation and for the introduction. I will share with you in the next 15 minutes some of my expertise in the area of space, life science, space medicine, with applications in terrestrial medicine. I think that's very important to have this link between what we do in terms of space research and what it can benefit the global health here on Earth. So just setting the scene now for us to better understand what happens to the human body in space. We know that nowadays the International Space Station is basically it mimics what we have here on Earth in terms of atmosphere, except for the CO2 that's a bit high, but the atmospheric pressure is basically at ground level, 14.7 psi. And it was a good evolution from the start of the space programs. As we can see that during the Mercury Gemini program, the pressure was very low, oxygen was very high, so it was not mimicking in terms, it was not, let's say, a good simulation of what we have here on Earth, which of course affect the health and the well-being of astronauts in microgravity. So if you consider that, and you consider the low Earth orbit missions, we can see that we are left, let's say, with 4 big challenges, which is microgravity, the effects of microgravity in human body and mind, the radiation of space, cosmic radiation, solar radiation, aspects related to the human mind in space, it's social and psychological aspects of a space mission. And of course, because the spacecraft is orbiting the Earth at 27,000 kilometers an hour, completing an orbit every 90 minutes, it gives 16 sunsets, 16 sunrise for the astronauts in 24 hours, and it disrupts the circadian rhythm. So I would say that these are the 4 main topics that you should consider. And of course, if you go to Mars one day, we are going to have to deal with the hostile aspects of the Mars environment, which is basically the low barometric pressure, low gravity in comparison to Earth, about 1/3 of our gravity here. We have low temperature and of course the distance that can create like psychological issues, emotional problems, and also communication problems. So this is, let's say, the scenario that we have to be concerned, and this creates, let's say, a way to approach these issues, these medical issues, physiological issues, in 3 ways. So in my opinion, we have 3 types, let's say, of space medicine. We have space physiology that basically observes the change that we have when exposed to an extraterrestrial environment. We have operational medicine, which is dealing more with the logistics of flight, so how many hours you are going to sleep and when you are going to exercise, and the meals that you're going to have every day and so on, the hygiene and so on. And the clinical medicine, which is the area of medicine dedicated to diseases that can happen in space, both diseases that affect the body or the mind of astronauts. So I would say that we have these three main areas. And in terms of what we know based on the space physiology change that we have in space, we know that there are some body systems that respond very fast to microgravity and also adapt very fast, like the neurovestibular system. We have systems that are like, say, they change very quickly, but they take longer to adapt, like the cardiopulmonary system. And you have systems that are affected continuously during the exposure to microgravity, you know, like the muscle, skeletal muscle system, bone system, which for them, we need, of course, to have countermeasures all the time to be implemented during a space mission. So we can divide the challenge or the change in our body in acute change and or short-term change and long-term change. We need also to understand that we have like 570 approximately astronauts in the history of human space exploration, but we just 11% of them are women. We know by now that although with very small sample size of women going to space, that we have important difference that we need to take into account. So what we know now is that we have this change. This can be short-term change, long-term change. We have change that are more related to one gender than the other. And my main goal today, as we are dealing with the application of microgravity on medical, in the medical area, is to show a bit of my experience, 30-year experience in studying and researching in this area. And I think that it is clear to me, as it should be to all of you, that we have, we develop knowledge, products, methods, techniques, process that some of them are developed for space and should stay in space. There is no main application here on Earth. And we have many, of course, that you develop here on Earth that should stay here on Earth, but you have this bridge between Earth and space that should be explored. So this is not new. For more than 40 years, NASA has explored that the applications of space exploration here on Earth, so-called spin-offs, and the first one is called health and medicine. And you can have a list of that, like telemedicine, human psychology and physiology and medicine, findings and applications here on Earth, development of medical equipment and devices, disease investigation, treatment, exercise, and space countermeasures. So how can it help with rehab here on Earth, for example? And I'd like to bring two of my research to you. One is related to the extraterrestrial cardiopulmonary resuscitation. I have been working in this area for the last 20 years. And the other one is the development of a medical device that can use in space missions for blood collection. So here, in fact, is a slide that shows the three main techniques that are now used or accepted, that could be used in space in a case of cardiac arrest: the handstand, the reverse bear hug, and the Everts-Husserl CPR method. So all of them were tested in microgravity, in acute exposure to microgravity during parabolic flight. So in terms of our research, our technique that we developed, called the Everts-Husserl. This is the first aid, which means that if someone has a cardiac arrest in space, you can start BLS, CPR, cardiac external chest compressions and mouth-to-mouth ventilation immediately, because you do not need any extra equipment to stabilize, let's say, the patient or the rescuer to start this type of CPR technique. So this is the first aid possible, very quick, very efficient. So you have here our parabolic flight. We had two researchers from England, Simon and Lisa Everts, and two from Brazil, me and João Castro. And we were very happy with the results. We had good chest compressions and ventilation. We compare that with the other studies performed by NASA during parabolic flights, and it was extremely, sorry, you have to drink some water. No, it's not good to cough nowadays. Sorry. So we know that in a parabolic flight, you do not have enough time to perform CPR for many minutes. You have just 20 seconds. So one idea was to create a body suspension device in which you could suspend the person and the dummy. So you simulate microgravity in terms of body weight. So that's what we did in Brazil. We conduct many experiments checking the Everett-Russumano technique in terms of, let's say, not just expand the time, but also checking for the effort of performing the maneuver. This is basically the rescuer embraces the dummy or the victim, no, the patient, by using the left leg around the right shoulder and the right leg around the torso, leaving the chest area free for chest compressions. So we had this first experiment done, and it showed that it's very hard to perform. But one thing that caught our attention is that we needed to flex and extend the arms when you perform CPR in microgravity or even in hypogravity simulations. And I'll show that in a minute, because you do not have the weight of your body to create the chest compression. So you need to flex and extend your arms, which is the opposite of what to do here on Earth, that you need to keep your arms straight and then use the weight of your body to produce the chest compressions. So you have here the results. I just highlighted in red here the most important ones at 1G as control, and in microgravity simulation, in which you have it's much harder. Not the board scale measures that, and you can see that it goes up to almost 18 points against 10 points at 1G. But again, what calls the attention is that you do not flex your arms at 1G, but you have to flex your arms, flex and extend your arms when you are performing chest compressions in microgravity simulation. And heart rate, of course, goes up to 170 in 3 minutes against about 115 at 1G. So it's very demanding for someone, but that's very important because you have 3 minutes of, let's say, CPR going on while you are bringing, let's say, other equipments, defibrillators, and try to stabilize the patient and bringing other material and medical devices. We expanded that the micro GCPR to hypo GCPR. In this situation, do not have to assume a different position. Don't have to use the handstand, of course, or the reverse bear hug, or even the Everett-Russumano position, because the astronaut that suffered the cardiac arrest will be lying on the floor. So you assume the same position that you do here on Earth, which is basically the one that you can see in this figure here. And you perform CPR with less, let's say, less body weight. So you use the same body suspension device to decrease the body weight of the subjects. And you can see that by decreasing the gravity, you can also decrease the chest compression depth, and you have to increase the angle of your arms, no, the elbow angle, to promote the chest compressions. When you look at the male data, no, sorry, I didn't mention, but this is the female data. When you look at the male data, you can see that the depth of the chest compression is kept, but again, you are increasing the angle of the elbow to compensate for the lack of weight. We also improve the technique a bit, not using the same position that you have here on Earth when you perform BLS, but also that is perpendicular to the rescue stays perpendicular to the patient, but assuming that this position that is in the picture, in which we basically embrace the dummy, using the legs of the dummy to hold our legs, so we stabilize our body like that. So you can use the body suspension device again to test that. This is also published in a paper, a new technique to perform external chest compressions during hypogravity simulation. We have many publications, in fact, that was performed over these years of study, looking at many different aspects of CPR, not just the elbow and the effort to perform it, the elbow angle, as I was mentioned before, or heart rate and so on, but also electromyography and other physiological variables. So this is a chapter that is available open access, so everybody can just download the chapter if you want to know more about CPR, extraterrestrial CPR and applications here on Earth. And coming to the application, that's very important. Remember that I said that here on Earth, every single guidelines from the beginning of the definition or of the guidelines of CPR that happened in the 1960s, you had to keep your arms straight and then use the weight of your body to perform CPR. This might not be the case, though, if you have a patient that is very big, a big chest, or has a disease that creates this big chest, that increases the anterior-posterior diameter of the chest. In this case, it's like to be simulating microgravity or a hypogravity. And we need then to flex and extend the arms to promote a better chest compression. So we have done some studies proving that. We are about to do another one. So it is very important to see that for the first time you had the motivation, let's say, to think about an alternative for CPR when there is this discrepancy between the rescue size and the chest of the patient, not extending the arms, but flexing, extending the elbow of the rescue to promote CPR. And the second example that I would like to share with you is a device that I developed together with friends and colleagues from Brazil and also from here, from the UK. We call that the Van Gogh project because, in fact, we were cutting the ear of the earlobe of the person to collect blood. So it's not collecting blood from the vein or from an artery. It's collecting arterialized blood from the earlobe. And it's very similar to arterial blood, which is a technique, in fact, that was developed here in England in the mid-40s, 1944, I believe, by two British physiologists. So the technique's not new. What we developed was a way to collect the blood safely without contaminating the environment. So very important for a space environment, and not contaminating the blood with the air of the environment. So just comparing the two techniques is basically pain-free. I have my earlobes cut, I don't know, maybe 200 times each during the development of this device. It's a kind of specialized syringe that you place in your earlobe to collect. I'll just show in a moment. There is basically no complications. It's a very superficial cut. Anyone can perform it, minimal training, 5-minute training is more than enough, and it can be performed in space and here on Earth. That's the beauty of that. So here is me collecting blood without the blood collector. You can see that's a bit messy, with lots of blood around, because you have to promote arterialization of the earlobe. I'll show in a moment, and then collect the blood. So we developed this series of earlobe arterialized blood collectors. Start with a big one, almost 600 grams, and ending with a very portable one, that's this one here. So from 600 grams to 18 grams, and it was, many things were changing during this process, not just the size, but the type of blade that you use and so on. We end up now with a blade that's an ophthalmic blade, very easy to perform. And you can see that this is the process, arterialization of the earlobe with a massage. You clean the earlobe, put the blood collector, turn it once, the blade comes out, cuts the earlobe, you turn it again, you then collect the blood in a cartridge, goes to the machine and analyze it. We test that in many different situations here on Earth, simulating hypoxia, 12,000 feet, simulating, in this case, 12,000 feet during head-down tilt, collecting blood from the artery, radial artery, and the blood from the earlobe at the same time. We were very happy with the results. We also tested with patients in a hemodialysis clinic, collecting blood from the arterial side of the fistula and the earlobe. We did some other studies with partners in Spain in intensive care unit. So we also have the data from, let's say, clinical application of that, because there is this very, let's say, clear application from a space, from a technology or a device, medical device that was developed to be used in space. And with the application here on Earth being so clear, we had this, the blood collector was invited to be part of an exhibition at the Science Museum here in London, showing exactly this connection, this spin-off from what is developed for space and how we can use here on Earth. Again, several studies were published based over the years. Now, some related to applications or studies done here on Earth, and some in space. We also have very recently, now in 2020, I'm not sure when, in fact, 2 or 3 months ago, we had this the publication of this chapter, and you can also download it for free. That explains all this, let's say, the development of this device and application here on Earth. We had the possibility to test it during parabolic flights, which was very important because we tested head down tilt, we tested in hypoxia, we tested in different sets of, with different sets of patients in hemodialysis, as I said, in intensive care units, but it was very important to prove that it was also capable to be used in microgravity. So here is our team, basically testing it in microgravity. It was, of course, very successful. The capillary action to collect the blood occurs in the same way that you have here on Earth. So we are very happy with the possibility. So thank you very much for the invitation again, and I stay online for possible questions and answers at the end.
Thank you very much, Thais, for this nice presentation, showing us actually 2 very clear examples of research that's done on space and how it benefits applications done on Earth. And actually, here it's one of the purposes of this workshop. And now we have been talking about medical applications, and our next speaker is Tiagi Punit from AstraZeneca, who will provide us also some more related to pharmaceutical applications. So Punit, the floor is yours.
Sorry, just 1 second. Got to remove. Okay. Okay, so let me share my screen there. Okay, can you see my screen?
Yes, we can see your presentation full screen mode.
Okay, thank you very much for this invitation. I'm going to briefly talk about some work that we have done at the International Space Station. And it's primarily related to drug delivery. That's my focus of research at AstraZeneca. But before I go into details about what the experiment was, just a brief overview of what delivery systems and specifically nanoparticles, what we made on the International Space Station, what they are. These nanoparticle systems, they are being, for those who don't know, they're basically made of polymers. And we use them for sustained delivery of active molecules of drugs, and then also for protection and intracellular delivery. So when you want some drugs to go into the cell, for example, many of the genetic material, mRNA, DNA, they all need to be delivered inside the cell. If you just give them as such, they will get degraded. But then when you encapsulate them in these protective nanoparticles, they serve as a mechanism of protection and for their improvement of efficacy of those molecules. I have a picture up here on the top right hand of showing some 10 images of those nanoparticles. They look very spherical, as the word particle suggests. And another advantage of these particles is that it can provide a long-term sustained release, as you can see in the graph on a figure that's on the lower right hand. It shows us that how a single injection of nanoparticles can sustain release, the blue one, for over a long period of time, in comparison to immediate release formulations that have to be injected after every interval. So that's why these nanoparticles are important, and we have been focusing on them for many years. And some of these molecules are also in the clinic. So these formulations are in the clinic also. Next aspect is the project objective, what we were planning to do. And as I mentioned, we were working on the International Space Station, which is this modular multinational collaboration. Which serves as a microgravity and space environment research facility. So what we planned to do was we wanted to evaluate these manufacturing process of nanoparticles up in space. We manufactured them aboard the International Space Station. And then we made a similar batch back here at AstraZeneca. And then we characterized the formulations, both the International Space Station and what we made here on ground in Earth's gravity. And I'm showing a picture right here on the bottom right hand as of the system that we set up on the International Space Station. So these glass bottles had the dispersion media, and then in that we injected the polymer solution to precipitate it out as nanoparticles. And there are these blue stir bars that we were using to give it a stirring process. And the picture on the corner right is the setup, a more view of it, showing that we had a camera attached to it to take regular video images and as well as some images of still images. So the question, why do we manufacture these nanoparticles in space? So what we hypothesized was that gravitational forces, they have a significant effect on nanoparticle formation process. As you can see in the image that I have on the right hand, the nanoparticles, when they are manufactured, the drug can be released by two different mechanisms. It could be diffusion, the nanoparticle stays as such, and the drug just diffuses out into the liquid it's been dispersed in. And then another one is an erosion. There are biodegradable polymers that you can use, and when you inject them in the body, they degrade. And then as the degradation happens, they erode, and then the drug is released. And both these mechanisms are very fundamental to the release process and to the overall performance of these nanoparticles. So what we wanted to understand was that if we manufacture something in a microgravity, does it help us improve the process? Primarily because the coagulation process that is happening, when you're injecting the polymer solution in a water base, there is going to be some coagulation, and then the polymers, form these nanoparticles, and this formation is very sensitive. It's sensitive to the gravity-induced perturbations. There is shear involved, sedimentation, convection, and there's this hydrodynamic pressure. All these processes are very critical in defining the final product. So we wanted to delineate this mechanism further and direct us to make a more fine-tuned formulation that can have a much better efficacy in human beings. So once we had manufactured these formulations, we evaluated them here in the Earth here. So we can see that there's a scanning electron microscopy image on the left hand, and it shows nanoparticles that were manufactured here at AstraZeneca, that's the A, and in comparison to nanoparticles that were manufactured in space, in microgravity. The size was significantly different for both of them. That was one of the main observations we had, that was what was manufactured at the International Space Station were much bigger in size, 500 nanometers, whereas what was manufactured here on Earth was approximately 200 nanometers. And some other critical differences that we observed was density. For example, if you look at the table on the right hand, nanoparticles manufactured at ISS had a higher density, and they had less force in it, which you can see from the total porosity being given here. It's 23% in comparison to a Earth's gravity manufactured nanoparticle, which has a much poorer structure. The surface area was low, obviously because of the increase in particle size, and then they have some exact particle size given here, and the pore diameter was less. So all these indicate towards us that there was as I mentioned earlier, that our hypothesis was that there will be a lack of convection, and so when the convection was less, during the manufacturing process, once you inject the polymer solution into the water or the aqueous phase, the nanoparticles form, and then whatever is encapsulated, all the solvent that is encapsulated within that structure that has been formed, it has to move out of it for it to dry. And during that, that's where the convection part comes in. And if there is no convection, it moves out very slowly, And obviously, because it's trying to move out, it's also increasing the size. So these were the observations that we had, and there were some very astounding observations. And this serves as a very basic fundamental building block, you can say, for our future research that we would envision in a microgravity environment. Because if we can make such kind of microgravity formulations, in an environment here on Earth, we can control so many parameters, the density, porosity, and we can make the whole process streamlined. And what the impact was, and as I've mentioned here more clearly in this picture here, when you manufacture something in the Earth's gravity, you can basically expect two different form of particles. There's a slow solidification. You get a medium porosity, medium density. That's what generally you get when you're making nanoparticles. And these pores, these white lines you see here in the particle, they're formed during the time when the solvent is trying to come out of the process of the nanoparticle. It could be a highly porous, low density product also, if the solidification is much faster, and there are processes by which you can do that. In a very different scenario, in a microgravity environment, what we observed was that it was a combination somewhere in between both these formulations of a slow solidification and a fast solidification. It was low porosity and a high density. And when you make something with low porosity and high density, looking at the drug molecules, right? When we are working with biologics, we're trying to encapsulate proteins and antibodies. When you have there's a more cohesive matrix, then you can stabilize the drug molecule much more efficiently. Because if you have more pores, there is the dispersed media can easily come into it, and that can destabilize the drug molecules. And that's what we feel is the important aspect of this research, that we get this understanding that now we can encapsulate biologics much better, or even other molecules much better. So with this insight, we have plans, and there is some envision to go further, how we can go into it, and what does that future directions look like. As I mentioned, we can continue to build on this work, and the manufacturing process that we used for this particular formulation that we manufactured was a very, I would say, a crude one. We didn't have all the equipments there, and it primarily because it's very complex to take something up in space, because it's not as simple as, okay, it works on Earth, it will work in there also. There are lots and lots of stipulations that we have to go through in terms of cost, in terms of time that it requires to develop those instruments, in terms of their efficacy up in space. So in a future experiment, what we envision is that we're going to streamline the process further. For example, I mentioned that there was a stirring bead in the image that I showed earlier. We can have a magnetic stir bar that can control it manually, rather than a person physically moving that bead. Another thing is, how do you inject that polymer solution into the aqueous base? We can have a syringe infusion pump that can do it in a very, very controlled fashion. You can tell it exactly how much ml in how many minutes. And then furthermore, dialyzing the formulation that is ready. Dialyzing is necessary because you need to remove the excess free drug and all the other components, so that you get the pure formulation. That capacity was not available to us at the moment we did this experiment. So a more accurate reproduction can be performed if we add these aspects to it. And the next aspect was, what we manufactured earlier was just a blank nanoparticle. It didn't have any drug in there. It didn't have any actives in there. So the next step would be to make a drug-loaded formulation up in space, but it makes it much more complex. You have to look at safety of the people who are going to be exposed to the drug. You're going to have to look at the stability of the drug in space, and many other such complications will come up when we go further with this. And in a bigger picture, the reason we think this research is so much beneficial for us is because it gives us a very futuristic view, right? When we are thinking of further explorations of our solar system. We just talked about going to Mars. Then you cannot just make a formulation, or you cannot just make a medicine and give it to somebody expecting, oh yeah, somebody in the future you'll fall sick. if you could have all the raw materials up in space, you can make the medicine right there. It just makes it more sense. Because when you make a medicine on Earth and then you send it, everything changes, stability, storage conditions, and whatnot. So that is why we envision that this research is very fundamental and very insightful for us. And that's where we see the future going, trying to understand microgravity and using that to improve conditions of residents of this Earth planet. So with this, I'd just like to thank you all for your attention. And I look forward to any questions that come up later on. Thank you very much.
Thank you very much to you, Puneet. It was a very, I like very much this presentation because it showed us a very clear example on the research that you did in the ISS and the benefit that it brought to you to your research capabilities. Probably I will have some questions afterwards. And now also we want to know a bit more the point of view of a research center that has experience in this field. And for this, we have with us Markus Wieland from the Otto von Guericke University in Germany, who's gonna present us the presentation, which is called The Influence of Microgravity on Human Cells. Markus, welcome, and the floor is all yours.
So thank you very much. I will just share my screen now. Can you see it, everything?
Yes, we can see it in full screen. Thank you.
Excellent. So my name is Markus Wieland. I'm speaking on behalf of Professor Grimm's Department for Microgravity and Regenerative Medicine, and I'd like to present you a little slice of our research. So when we are doing cell biology in space, we can cover three branches of research. First, the basic science, which can give us information about changes in gene expression, changes in the cytoskeleton of the cell, signal transduction, cellular differentiation. Then, of course, there's the medicine part of our research, which covers cancer research. We can gain insights into aspects of regenerative medicine, omics investigations, immunology, muscle and bone research, and so on. And of course, the translational research, where we will then use these data to improve our tissue engineering methods, to generate multicellular spheroids, and have some space pharmacology experiments to find new targets for example, cancer treatment. So research opportunities in real micro-G are manifold, but for biology purposes, the drop towers are not really suitable due to the really short time of microgravity. A widely used platform are the parabolic flights and of course the sounding rockets, and still the space station is the gold standard, but that is quite a rare opportunity. So if we expose cells to microgravity and compare them to normally adherently growing cells, we see that cells usually have their actin fibers oriented in this more radial mode with clearly connected focal adhesion proteins. The microtubules are also stretched and radially elongated. And when we are now exposing cells to microgravity, this picture changes radically. Actins fibers are actually losing their organization. They're more or less dissolved, and they will accumulate more around the cell nucleus and inside the membrane. The microtubules are also more amorphous, and the focal adhesion proteins have mostly lost their connection to the actin fibers. So we have been fortunate to be able to develop a new microscope together with the DLR and Airbus, which allows for live cell imaging during parabolic flights, during sounding rockets, and also on the ISS. And these are the first pictures that we have gotten from a sounding rocket experiment. This is the cell in 1G. The green color you see is a live-act GFP marker protein. So the green signal is basically actin. And we see here also the stress fibers are nicely elongated as they are supposed to be. And during flight, in a live cell, this is not a fixed cell, it's a live cell, we see a complete loss of actin structure inside the cell. We see the development of filopodia and laminipodia, and also we see a detachment of one of the cells in micro-G. This was also repeated with breast cancer cells, and we found basically the same results here in the actin part of the experiment. During flight, we see disorganization of the actin, we see an accumulation around the nucleus and inside the membrane. And the same is also true for integrin. This is also, tubulins, my fault. The tubulins also are being disturbed in the structure. They will also accumulate around the nucleus, and there are holes inside the cells where tubulin is actually being disrupted. Apart from analyzing single cells, of course, cell accumulations are more interesting. And what we have observed in our manifold experiments is that cells which have been growing adherently in 1G, when we expose them to micro-G, either in a simulation device like the RPM or clinostat, or to real microgravity, they will detach and form multicellular spheroids. And this was found for endothelial cells, for thyroid cancer cells, for breast cancer cells, and even for chondrocytes. So these multiple cellular spheroids are very interesting things, because on the one hand, they can reflect the situation of a tumor. If we look at the tumor here, we see the capillary in the inside, and all the nutrients are being fed into the middle of this small tumor, and they are depleted towards the outside. In an MCS, this situation is reversed. So all the nutrients are being fed from the outside. So an MCS is basically, and also the proliferation is higher on the outside than in the inside, other than in a tumor. So a MCS is firstly a inverse tumor model. But secondly, as I said before, these MCS are generated from adherently growing cells, and therefore they have to detach from the surface and then form these MCS. And this is basically, especially if we take cancer cells, a process very similar to metastasis. And therefore, we are hoping that these cells and these processes in microgravity will give us insight into the processes of metastasis, and also help us find new targets for the pharmacological treatment of cancer and anti-metastasis prevention. So what kind of genes are actually involved in this process of MCS formation from adherent cells? So we have done a space mission on the Shenzhou 8 flight with the Chinese, and we found that after 10 days in real microgravity, the epidermal growth factor was highly increased compared to the 1G in-flight centrifuge cells in thyroid cancer cells. So EGF obviously is one of the major players in MCS formation in microgravity. We could also see this on our next mission, the Cellbox mission, where we use the same cells, and we could replicate this result. And it's also interesting to see that on a Texas mission, where there's only 6 minutes of microgravity, these results were not found. So this is obviously a long-term effect and not a short-term effect of microgravity. VEGF-A is also a very important factor, as it determines the aggressiveness of tumors. And what we see here is, if we expose the cells to to longer times of simulated microgravity, VGFA will drop, and that was also replicated on a 10-day Shenzhou-8 mission, while on short-term microgravity like PFC or Texas mission, nothing of this was found. Similar results could also be replicated in breast cancer cells, but we also found after 5 days on the RPM, so long-term exposure, a significant drop of VEGF-A, while in the short-term experiment on the Texas rocket mission, we actually found a small increase, as reflected here in the red fluorescence intensity of VEGF-A inside the cells. VEGF-D is another factor, and VEGF-D is also implicated in a increased survival in patients. So patients suffering from tumors with increased VEGF-D levels have an increased chance of survival. So what we found here is increased VEGF-D. Interleukin-8. Oh, am I already too late?
We have 1 minute because we are running out a bit late. It's okay, Marcus.
Interleukin-D, which interleukin-8 and interleukin-6, which have pro-inflammatory purposes. They have been regulated down, and this was also found in breast cancer cells and thyroid cancer cells. So one more interesting experiment is caterine. Caterine was upregulated, and we could actually modulate the spheroid formation by interfering with caterine. First of all, we saw that E-caterine was reduced in spheroids, and if we inhibit if we have an inhibitor of this SRC, we can block the MCS formation, and if we block E-caterine, on the other hand, we can induce MCS formation. So this is the first interesting target for the metastasis inhibition. And secondly, NF-kappa B can also be interfered with dexamethasone, and increasing concentration of dexamethasone could decrease the spheroid formation. So in summary, we see that cells will detach from the surface. During this time, the pro-inflammatory genes will be upregulated. On the other hand, in the MCS themselves, several target genes are downregulated, and we can also compare or connect this to a redifferentiation and reduced aggressiveness. So what we have used is microgravity as a new approach for target search in cancer cells. We have some interesting new targets like NF-kappa B and E-caterine, and we will in the future follow this path to find new targets, to use new cells like breast cancer cells, and to finally, hopefully, find a pharmacological treatment for metastasis. So thank you very much, and sorry for the longer time of speaking.
Thank you to you, Marcus. Actually, it's a very interesting topic, this research on cancer, because it's a topic that it really affects everyone in the society. I appreciate your presentation. And the last panel that we have today, moving forward, is Paul Kamoun from Space Pharma. Space Pharma is an Israeli company that's providing access to microgravity conditions. And Paul is the CMO of the company. And today he will be presenting Microgravity for Health on Earth, New Space Revolution. Paul, the floor is yours.
Thank you very much for the invitation, Johan, and thank you very much for the introduction. Indeed, I will start with just a quick presentation of the platform we are developing. Space Pharma has developed actually a space facility which enables the widest range possible of life sciences research as well as commercial applications, as you will see. Actually, Space Pharma is a Swiss company with two R&D centers. The one is in Israel, as you said, and the other one is in Florida, close to Cape Canaveral. So let me start with a quick presentation with a very short video. Let's see if I can share screen with you. So I think it's fine. All right, let's go with a quick video which shows the full scope of what we are trying to do.
Sometimes in training, I feel like I've given it all, that it's as far as I can get. But then, on the big stage, with all the lights, all eyes on me, suddenly I feel like a second push, like I could fly. I'm unleashed. And it all comes down to one simple thing, your environment. If you change the environment of your experience, you might be able to change its outcome. It could actually be a universal thing. What if every challenge, every research was simply done in a different, limitless environment, say in space? Space has indeed already brought revolutions in telecommunications, transport, astronomy, observation of the Earth. What about health? Could, for example, pharmaceutical, medical, biotechnological experience done in space and monitored from Earth bring unparalleled, incredible results? That's what Space Pharma does. It's a game changer.
Space Pharma is pioneering the development and exploitation of high-performance, remote-controlled, miniaturized laboratories flying in microgravity on satellites and space stations. For the pharmaceutical industry, Space Pharma is fostering accelerated new medical drug discovery and preclinical trial and new vaccines through improved space-grown crystals of proteins. In cosmetics, Space Pharma supports the discovery of new anti-aging compounds using skin-on-chip in microgravity for accelerated skin aging process. It also uses hair follicle tissue as a model for impaired hair growth and accelerated testing of hair care agents and medications. For the food industry, it increases production of lipid antioxidants from microalgae and microgravity for nutritional food and dietary supplements. It provides the biotechnology industry with an advanced laboratory for stem cell proliferation, while keeping full differentiation capability for neurons extension and for discovering new gene expression profiles, which have no counterpart on Earth. It helps develop 3D tissue regeneration and stem cell therapy for the medical domain. Even more, Space Pharma develops the first ever factory in space for advanced and unique drug and cell production in collaboration with health institutes and industries.
Health innovations will never be the same. So don't just give your projects a boost. Give them wings.
Space Pharma, working in space for health on Earth.
Okay, so what I would like to show you now is a few slides which explain in more details what we are trying to do. So let's hope that we can share the screen again in the right way. All right, so let me go to all right, full screen. All right, so just a quick reminder of why we conduct research in space. We have seen through the previous presentation very interesting ones, a variety of applications. Clearly, biochemistry producing very pure and bigger crystal is a very important application, important to develop new drugs. But medicine is a growing domain with, in particular, the accelerated models of aging and the accelerated model of disease modeling, in particular for neurodegenerative disease. and for antibacterial resistance, and even today with the virus COVID-19 studies. So many different applications. And our platform is allowing all that. I'm going to show you a few examples. Clearly, it's a domain which is on the verge of becoming extremely commercial. The global projection for the space market for life science in a couple of years, 2024, is about between $1.5 and $3 billion. So it's something which is growing very fast. And the different platforms which are available, the ISS, at least for R&D, and platforms such as ours for commercial are going to help this evolution. The topics which are being tackled are, of course, research and development, as it has been for many years. But also now we are going clearly commercial, in particular to accelerate and improve drug discovery. Everything is, I mean, not everything, but a lot of phenomena are happening faster in space, which means that in particular, you can gain a lot of time on preclinical trials. To develop a new drug normally takes about 15 years and $2.5 billion when it's successful. When it's failing, it's about already 1.5 billion lost. So if you can gain at least a couple of years in the preclinical trials, if you can do that in space and also not using animals, which is ethically also quite interesting, of course, you can really be a game changer for the industry. So that's what we are doing already with some pharma company. So what is specific about space pharma? Number one, our lab is really miniaturized. It has the size of a shoebox. It's remotely controlled with a smartphone application. So the scientist, the user, can see everything which happens in the space lab inside. You can see on his smartphone. And high performances, we have the microscope, we have the camera, we have everything. And everything is operated in real time by the user. So it's really something very new. And it brings a lot of advantage. In particular, the user can modify the protocol in real time if he believes the experiment is going one way or another. He desires something a bit different. So we have been already 5 times to space. So we are now fully operational. We did, of course, a parabolic flight, which is not space, but we have our own satellite. We went to the ISS 3 times. So, and we are preparing for the future shuttles such as Axiom or the Space Radar. So the solution, as I said before, is fully operated by the user with his smartphone, and he can see on his computer what's happening. And the advantages are huge for this kind of evolution, because it's going to be a game changer for the pharmaceutical domain, and of course also for the cosmetics, because you know that a lot of developments for the cosmetic are related to aging, aging of skin, aging of different organs. And this is coupled with the developments in regenerative medicine, because organ development, in particular what we do with our lab, with lab on a chip and organ on a chip, everything is miniaturized. It allows to develop organoids and study in particular brain disorders and different things using brain organoids, and same thing for other organs. So finally, we can say that there is a great potential. This platform is available for science and for commercial, of course, and the impact on society will be expected to be important, because it's going to help saving important budgets because of saving time on preclinical trials. And also this means faster treatment and better policies and so on. So I think this revolution, which is happening today in space, in life science, is going to have an impact not only on health, but on different part of the society. And I think that's quite interesting for all of us, all the participants which have provided their insight. I think we are all in the same process now, trying to make it fully operational and available for all the citizens. Thank you very much for your attention.
Thank you very much, Paul, for your presentation. And now we are running out late, but if the audience has some questions you can ask. We have already one question from Maria Joao. It's a question addressed to Puneet, and the question from Maria Joao is, how is the partnership established? Contracts and IP issues to overcome. I believe that Maria Joao wants to understand a bit more about this topic. So Puneet, if you could please expand a bit, we'll appreciate it.
Yeah, sure. So we work with CASES. CASES is the Center for Advancement of Science and Space, which takes care of the International Space Station. And as I mentioned, that ISS is a lab in space, and so they came to AstraZeneca for a presentation, and they mentioned about how CASES works on ISS, and we submitted couple of proposals to them, and then it got accepted, and then we went through a long process of getting the contracts in place. As you mentioned, yes, getting the contract was a big long thing. It took us over a year, a lot of nitty-gritty details in there. So reaching out to CASES is the way I would suggest for anybody, and because they're always looking for research partners to work on. There was in terms of the cost, the cost was, we paid a major chunk of the cost. When I say we, means AstraZeneca paid a major chunk of the cost for it, and as there was some from their end too. But yes, significant cost was also involved in that. In terms of IP, the research that we did was not necessarily proprietary to us. It's just a manufacturing process for nanoparticles. But I guess that when it comes to IP, I'm sure that there would be ways that CASES has already thought about it, how to work around it. When it comes from an AstraZeneca perspective, we have a set of, you would say, guidelines for IP, what can be disclosed and what cannot be, and we get into an agreement with the company working on it. So those are some basic thoughts that I have right now to answer that question. It's a pretty broad question, and I'm sure there can be more that we can add on, or if anybody else wants to add on.
Thank you, Puneet. Actually, that's a very important topic, and maybe related because Marcus, your institute has a lot of experience doing microgravity research, and perhaps you can tell us a bit how does the process go from the moment you have the idea that you apply, and where do you apply until let's say the experiment is launched, and then you get the data. A bit, what's the timeline and what's the process? If you could explain a bit.
Yes, sure. So the timeline is actually quite long. So for example, if we take the Shenzhou mission, it took from the first inception of the idea until the actual implementation of the flight about 8 years. So we have to apply usually at the German Space Agency, the DLR, or sometimes also we have to apply at ESA. And then the experiments are being reviewed, and if you are chosen and your experiment is being chosen for a flight, then the actual hardware design begins. Then some companies like Airbus or other companies that will actually do the hardware for you are being involved. That takes also very, very long time. And then it also depends on which kind of space agency we are flying with. Shenzhou was with the Chinese. We had other missions to the ISS together with NASA, and that can always take quite a lot of time because there's lots of bureaucracy involved. So I think in the least you have to count like 5, 6, 7 years from start to finish.
Okay, thank you. Thank you, Marcus, and perhaps Paul. Actually, you can explain what Space Pharma is doing to reduce this lead time. But also, there's a question from the audience to Space Pharma. Paul, I will read out loud. Denise is asking if you could give us a comparison between the quality of microgravity on the ISS, and he mentions transient acceleration due to human presence, and the level of quality in unmanned systems such as space rider or satellites.
Yes, okay, I can just share screen, just show one slide to respond to the question. I think if you can see the slide now, yeah.
Yes, we can.
All right, so to show the comparison between what is happening on Earth and what is happening in microgravity, we can see, for instance, on the top right of the slide, we can see the difference in size of the crystal that we have produced on Earth and we have produced in our lab in space. You see a big difference, and also on the right you see the size, the length also of the crystal, and so you can see the purity and you can see the size, and we measured that in the lab. Actually, we have developed, just as an example, we have developed a specific crystal for a pharma company, which allow to produce a medicine which could not be produced with smaller crystals. Smaller crystals were making it difficult. It was related to some part of the body. I cannot say because it's a bit confidential. And basically the part of the body was rejecting it, and they needed some bigger crystal to work on it in order to produce the right drug. And so this is an example of something which was not possible on Earth and which has been possible in space because of the purity and the size of the crystal. And you can see that on the pictures.
Okay, thank you, Paul. And maybe very quickly, regarding the lead time that Marcus was saying, from the time that you have the idea and until the experiment is flown, what's actually Space Pharma's approach? How do you reduce this? Yeah, actually, our lab is fully operational. So in terms of development of the hardware, we don't have, we have just a couple of months to work with the customer to design the chip which will fit its experiment, the microfluidics chip. And then we are basically ready to launch after all the system tests and so on within 6 months. If we have a launch opportunity, actually today the main driver is having launch opportunities available, and that's why the ISS is quite limiting because it goes only 4 times per year, and that's why we have our own satellite in order to accelerate the process. So if we have from time 0 with a potential user of experiments, it takes, and we have the flight opportunity, it takes maximum 5 to 6 months to be in space and bringing back the results directly to the user on his computer. 6 months. Okay, thank you. That's very good to know. And we can see that maybe a bottleneck is still a flight opportunity. That's also a note that I take. And the last question I want to ask, because we are running late, it's to Thais. Thais, you have been providing us with 2 examples, very clear examples of medical applications. And maybe my question is more related on what's next. What are the next projects that you want to do, maybe here in Portugal also, and so on. Thais, you're mute.
Thank you very much for the question. Yeah, well, I hope we can do lots of stuff like that in Portugal. It is, we are establishing a center of research in aerospace medicine at the Faculty of Medicine at the University of Lisbon. And I have a huge experience, in fact, in working with in university with research in space physiology and medicine. And one of my goals is always to connect whatever we are doing for space, connecting here with Earth, to have some benefits for our for medicine or other health-related areas. So I think that we, I'm hoping to expand that. We also have studies done not just with the human physiology itself, like I showed the cardiopulmonary resuscitation, as I also showed the development of devices, in this case, the blood collector, but we also work with cells in microgravity simulation using 3D clinostats, and the telehealth, which is also a good application. There is enormous application here on Earth. So it is a vast area, and I hope we can develop lots of research in Portugal, connecting it with international friends and partners, space agents, other universities, research institutions, companies, and I'm very hopeful that we are going to help give a kind of collaboration for the presence of Portuguese in the space era.
Thank you, Thais. We also hope so. That's one of the purposes of this event at the end, it's to raise awareness of the possibilities. So I want to thank you all the panelists for your time and your interesting presentations. Puneet, Marcus, Thais, and Paul, thank you very much. We don't have more time for questions. So now we'll have the lunch break. We'll continue in 1 hour roughly at 2 p.m. Portuguese time. In the afternoon, our panel, stay tuned because it's going to be more about commercialization of access to space, and we'll have MIT and ESA providing maybe more institutional point of view, but then we will have 3 private companies that are providing access to space that will tell us what they are doing. So please stay tuned and see you in roughly 1 hour. Welcome back to everyone that's here attending today's microgravity workshop in this afternoon session. Today we have had already in the morning 3 different sessions, one devoted to keynote speeches from institutional entities here in Portugal. Then we have heard about ESA's sci-space program and also how industry is working in developing payloads from CNR and MIT Portugal. And then we have had a more technical discussion on different medical and pharmaceutical applications related to microgravity research. And now this last session in the afternoon, I believe it's also going to be very interesting because it's more devoted to access to microgravity condition and also to commercialization of space activities. And today we'll start in the afternoon with a keynote speech from David Newman, director of MIT Portugal, and then we will hear what are the commercialization efforts that ESA is putting in place. And then we will get to know a bit more about what 3 very known space companies are doing to provide access to space. We'll hear Olympia Space talking about Blue Origin. Then we'll have with us Virgin Galactic, and last but not least, we'll have with us Action Space. So also for the audience and for the panelists to know, at the end of the panel, we'll have 10-15 minutes of time for questions. And if anyone from the audience wants to make the questions, you can write them down in the chat and then we will address them at the end. And also for you to be aware of it, we have this session here, but we also have a live stream of this workshop on YouTube. So there's more people also attending the event. And without further delay, Deva, the floor is yours.
Hello, good morning, and boa tarde for everyone. Can you hear me okay?
Yes, we can hear you, and we can see your screen as well. Yes.
Excellent, wonderful. Well, it's a pleasure to be here. Exciting workshop, and I'm thrilled to talk to you about space exploration from microgravity to partial gravity. I actually like to start at the very high level and just ask the 3 fundamental questions for research that we have. Are we alone? Are there other habitable planets? And what about life in the universe, past life or future life? When will we find it? This is an amazing view from the Hubble Space Telescope. So again, just I call it the fireworks of the cosmos, kind of looking into the infinite again for all of exploration. These fundamental questions and searching for life and the evidence of life in the universe. So at the very high level, I think this frames us and what's our place. And now we're gonna zoom in a little bit closer to home and talk about microgravity exploration, what we found out about astronaut performance on the International Space Station. Then I want to take you to the 2020s, the next decade, with human exploration will be on the moon. And that's all to set the stage for when we can get humans to Mars. It's been 20 years that we've had astronauts performing, working full-time. So can't see all the audience, but if anyone is 20 years old or younger, then it's really the space generation. It's really a generation that every day of your life, we've had astronauts, international astronauts. We're 240 people up working on International Space Station. Literally this week, we're celebrating our 20th anniversary. So it's really research off the Earth, but we say for the Earth, to understand about performance. I want to take you through some quick look at some of the data about how astronauts perform, what our major challenges are going forward in order to enable the future exploration of the moon and Mars. So I have up here some images and kind of how it all started back in 2nd of November and the year 2000. And here we are again, 20 years later. It's been an amazing international experience. The 5 main partners are NASA, the European Space Agency, Russian Space Agency, Japanese Space Agency, and Canada. But we have about 100 different astronauts who have been on board, and that's the important part. It really is a great example of international cooperation. Take a look. This is not to read, but I'd like to explain all the challenges that we have when we look at the astronauts and astronaut performing in microgravity. Now we're weightless. And so we really are looking at muscles and bones and cardiovascular performance, neurovestibular balance, all these systems, all of your physiological systems, because now you no longer walk or run, now you're floating, you're weightless, and all of your systems adapt, but they also change. And for the first time on the 1-year mission with Scott Kelly spent a year, and Mikhail Kornienko, his Russian colleague, we got to study kind of the omics. We've now sequenced DNA on International Space Station. Now we do RNA. So we really are in the era of omics, where we can tie together the integrated physiology from molecular cells. We study animal models all the way up to our human models, looking at the physiology, how people work and perform in space. We have significant muscle loss. We have significant bone loss because now you're not loaded anymore. We're really trying to understand the mechanisms of the physiology for all of these responses. Lots more on some of the data. I have to go quickly here. Also wanted to make sure to talk about the partnerships, and this is the public-private partnerships. Again, the government partnerships, but funding the commercial folks first to get the cargo up to International Space Station. So that's with Northrop Grumman, with SpaceX, also with the Russians, and with the Japanese supply vehicle. Now we've moved into the era this year of flying astronauts on our commercial providers. SpaceX has already flown, getting ready to fly again, and we have Boeing, the Boeing Starliner coming in. So it's a completely disruptive business model. Now it's paying for those services. NASA, the government, doesn't have to own and operate all of those. We can go to our commercial, our public-private commercial providers. So it's a fantastic new business model. It's really how we can think about the commercialization of low Earth orbit and then maybe moving out to deep space. Okay, a real quick purview into some of the data. I've taken lots of data in microgravity. Again, this is actually a little bit more the scientific part of the talk. If you're an astronaut, you're floating around in microgravity, you have to interact with handholds. Now, what is the loading level? What's the loading level that you might exert? We've been studying this on first the Russian Mir space station and now the International Space Station. And this is a lot of data of thousands of interactions of astronauts floating around. And the point here is this very low forcing levels. This is, up to, we have here up to 60 newtons. It's very, very low loading level. So why do we quantify this? Why are we taking all these measurements, understanding the astronauts pushing off? Because we were worried, would they disturb the microgravity environment? If we're trying to do very precise measurements in microgravity, we don't want the astronauts to really be disturbing the environment. So this data proves from the early missions, we've got the chance to fly with NASA and on the Russian space station, all the way through space station, the astronauts are really have very precision control, high precision control. So again, to take a look at that a little bit more detail, if I ask you to kind of, let's say, throw a dart in space, here on Earth, of course, we have gravity, and that's gonna be a trajectory. If you take a little ball and throw it to hit a bullseye, we have to study in microgravity, it just goes in a straight line. Why are we interested in that? Well, we're interested in how is the brain actually controlling our emotions in space? Because again, we're a floating, weightless creature now, and we have to worry about fine motion control. It's really fine motor control and very slow motions, very precise and very slow motions. And then we try to replicate that in our models and whatnot. Now, moving forward, I mentioned that we have significant musculoskeletal loss. When you are in microgravity and for months at a time, you have a lot of muscle and bone loss. So we've invented some suits, we designed some suits, and we're trying to recompress the spine. Also, astronauts get a lot of back pain in microgravity. So can we recompress the spine? I highlight this countermeasure suit. It's in conjunction with the European Space Agency, and the European Space Agency has flown it as a technology demonstrator, both on the International Space Station, a 2015 mission and a 2017 mission. So looking at all the interaction and work that we can do together on space station. This is just a few examples. We have a lot of animal data as well that kind of shows what the deconditioning. We also do, can't always get into space. It's very expensive to do space experiments. So we also do experiments in all kinds of simulation environments. So for the psychological stressors, the mental health, everyone in the world understands that today. When you're in an isolated, confined environment, that's what space, station is like. That's what it's going to be like when we're in deep space. So we can study and have analog missions, both about the physiology, but more importantly about the teamwork and the mental, psychological stressors. So we can do that in extreme environments, say Antarctica, also with European Space Agency in EnviroLab, the habitation module in Cologne is a fantastic research lab where we can study teamwork. We can also study the physiology, and we can study the psychological stressors. We also fly parabolic flight as well to get shorter duration, but that's the only way we can truly get microgravity and the partial gravity of the moon and Mars. So all of these different analog environments we use. Okay. So that's Earth, that little speck that you can barely see. This is Earth from Mars. So I want to switch now from microgravity and talk about when we go to the moon, 1/6 gravity environment. When we go to Mars, a 3/8 gravity environment, what are we concerned with keeping our astronauts healthy and keeping them safe? First of all, gravity changes. We have reduced gravity on the moon and Mars, not weightlessness, but reduced gravity. Is a very isolated, confined environment. So we have to think about all the life support systems. It has to be a closed environment. With radiation for deep space missions, then radiation is kind of what we call the number one concern. Can we keep our astronauts healthy? And I've mentioned the isolation and confinement and just the distance. We haven't been this far. What is that going to do to people's performance, to their well-being, to their mindset? So I want to take you quickly to a couple examples of research that we're working on for suits to keep astronauts healthy and well in space to cover up. I have hopefully you can see these little videos here. I call these my Apollo bloopers. We've been to the moon, we're going back. We need to provide a life support system. We need to provide a suit to enable the astronauts to do their science. Again, we've been there, it's 50 years ago, we're celebrating, just 50 years, but we have to design new systems, new life support systems, new mobility systems to keep our astronauts well. So in our research then, we're looking at, rather than a big gas pressurized shell that's 140 kilos, applying the pressure directly to the skin. That's called mechanical counter pressure. If we can do that, we can get a very lightweight system. We want the astronauts to be very mobile. It's going to be astronauts, you're in your rover, you have robotics. It's a whole suite of explorers, not just human explorers. And the next mission that NASA has to the moon is the Viper mission. That's a rover mission to go explore it. We're going to go to the South Pole of the moon. We know recently that the amount of water, we don't know how much water, but we have ice water. And when you look for life in the universe, when you want to support human, we say follow the water. We always go because we need the life support systems. We need to make sure that we have water. That's the best place to go. So we're going to go to the South Pole of the moon, coming up with the human missions that follow on the rover missions. Back to some of the designs, what we're thinking about in terms of, again, some of our advanced designs. We scan people. This is really, we call this the biosuit. It's a second skin suit. So we get very high precision measurements then of the person. We get an individual suit. We go through and measure and monitor so we can calculate basically this tight fitting suit. It has to apply the pressure that you need to stay alive. It has to apply 1/3 of an atmosphere. That's 30 kilopascals. And so moving on now, the current research is implying some active materials into these suits. We use some shape memory alloys and shape memory polymers to help us with the pressure production. And then most recently, today, what we're really working on then is how do we redesign the life support system to give someone mobility, get away from that big, large 140 kilo type of system, and then back to thermal control and radiation. Once we can provide an inner layer that compresses you and provides the pressure that you need, have to provide the oxygen, scrub your carbon dioxide with the life support systems. And just recently, now we're moving on to advanced materials for thermal protection, as well as some radiation protection. We're using some boron nitride nanotubes, so some some very interesting materials, aerogels for the thermal properties, and then for some of the radiation protection, their hydrogen filled nanotubes. So I know that's a very quick, but in respect to all of the wonderful speakers coming up, I want to make sure I end right on time. So taking you on a whirlwind trip from microgravity, 20 years of exploring, running our experiments, learning about astronaut human health, and now we're getting ready to be on the moon and then ultimately to Mars. So thank you very much for your attention.
Thank you very much to you, Dave. It was, for me, a very fascinating presentation and speech. And now we will move on to what ESA is actually developing when it comes to commercialization of space activities. And for this, we have together with us Bernard Hoefenbach, I hope I said it well, who is the head of the Strategic Planning Office at the Human and Robotic Exploration Program of ESA. Welcome.
Thank you. I try to share my screen. Give me a second. Can you see my screen?
Yes, but it's appearing the Zoom meeting. It's not appearing the presentation.
Okay, let me try something else. Is that better?
Yes, and now you're connected with full screen.
All right. Okay. So as was said before, I will talk a little bit about what ESA is doing in terms of commercialization. And I think in order to put it in a context, I think it's important to be clear that I talk about commercialization in the context of the ESA space exploration program. We have a program which is called the European Space Exploration Envelope Program. And what you see on the slide is somehow the scope of this program. Essentially, this activity, the program includes all our human robotic activities for 3 destinations, the low Earth orbit, Moon and Mars. So it entails our participation to the International Space Station, operations as well as utilization, as well as a discussion of what we do next after the ISS. It includes our participation to the early human missions beyond low Earth orbit, led by NASA, and in particular our contribution to the Orion Space Transportation System, as well as our contribution to the Gateway. It further includes our robotic lunar exploration activities, where we plan to send payloads to the moon, develop a logistic lander capability, but also provide communication navigation service in the future, as well as all what we do in Mars, delivering the ExoMars missions, but also participating again in NASA-led Mars Sample Return mission, which returns the first sample of Mars by 2030. So when we talk about commercialization in the context of this program, we talk about how can we commercialize and create value out of having humans in space. And of course, that focus in the first instance on commercializing the space station and its use, but it also extends to establishing service in support of future exploration missions to Moon and beyond. Now, why is ESA interested in commercialization? Commercialization is not an end for us in itself. It's not an objective. It's a means to an end. We expect that through commercialization, we can enhance the competitiveness of our industry. We can engage new users, new industry in our program, which currently are not active. We want to diversify also the type of users, the type of industries engaged. So having more industrial users also coming from different sectors. We would like to have more startups being active in the space exploration program. And ultimately, we hope that through commercialization, we contribute to economic growth in Europe. So I think it's important to underline that commercialization is for us an element of a broad innovation plan, which is meant to help us to deliver our exploration envelope program through different means. So the first, and in the end, what is our aim? Our aim is to establish and grow what we call a space economy. We see signs for such an economy appearing in low Earth orbit, but to some extent also in future on the Moon. And the idea is that we create a market where space provides knowledge, services, and manufactured goods for Earth, but also a market which supports our exploration undertaking, where space supports future activities in space by providing services, logistics, power, communication, navigation, but also it leads to the creation of products and consumables which are essential for conducting human operations in future on the Moon and later on Mars. So that's the context of our exploration initiative. We started all this in 2015 by publishing an open call for ideas, where industry was invited to submit ideas for commercial partnership. We call it commercial partnership, which would lead to to a service or product which would have relevance for exploration, and where ESA could be customer, but not the only customer. And based on this call, we received quite a number of ideas, more than 100. But as of today, we have established 4 concrete services. 3 of them are linked to ISS, 1 is linked to lunar exploration. The first service we established was IceCube. It's a small facility integrated in one of our RECs, which enables users to access ISS in a simple cube and for relatively low price. So it's for internal research in cube-size small payloads. The second service was Bartolomeo, which is our flagship partnership, because that led to the creation of an external platform mounted on the Columbus module, which allows more external research on ISS, mounting payloads for science and technology demonstration, Earth observation, and others. And then we also have commercialized one of our facilities, which is called Cubic for life science, which now also enables commercial access for commercial users. And then on the Moon, we are working on the creation of a lunar communication data relay service, which is meant to be operational by 2023. So as you can see, we have received quite a diverse range of ideas for commercial services. What's important to mention is that each of these services and each of the partnership is unique. ESA is a partner in all of the services, but acts in the background. The industry behind the services tries directly to promote the service to new commercial users. In many of these cases, ESA is also a user. So ESA has used IceCube, ESA is using Bartolomeo. So ESA again is an enabler as well as a customer. But the business model for the industry is only closing if they succeed to create sufficient commercial demand for these activities. You also see some notional prices, and the intent for all these services on ISS is to deliver the payload to ISS within 1 year after the contract has been signed. So with this also in Europe, we have clearly opened ISS to a new user community. And then, of course, based on this is not the only commercial accessible service. The service I showed was the ones where ESA is a commercial partner, but there are many other services existing in Europe and outside Europe, which enable users to directly access the ISS today. So we have in Europe, we have NanoRec, which has a European establishment now. Space Cargo, Space Rider is an important one, which is a retrievable space plane, which allows in future to also do microgravity experiments. That will also be commercially promoted. So that's another European ESA developed service. There's HostMe, there's Euro Microgravity. But we have also outside Europe, we have services which market access to ISS to European customers. So it's not necessarily restricted to national customers. And our intent is to promote the demand for all those services. So we're not necessarily limiting our promotion to the partnerships we have established, but we try in general to create demand for services which are today accessible on a commercial basis. And it's interesting to follow the success of our commercial partnerships. Again, our first service was IceCubes, operated by Space Applications. They have managed to deliver the first commercial activities in quite a wide range of areas, from biomining reactors to inspirational activities, to greenhouse demonstrations and protein crystallization activities. So it's quite a wide range. But it's also clear that it's very hard to develop this commercial market. And what you see in the planning is that there are further interesting activities for IceCube, as well as our second commercial partnership, Bioreactor Express. All these activities lead to applications because they're commercially driven, but they all have a very strong science content. So in other words, science still plays a key role in these commercial activities. The difference here is science is not necessarily the driver, but science is enabling. What's driving these activities is the application in mind. And what's also interesting on this slide, you see a number of activities which have been basically captured by the commercial service providers directly, but there are also activities which have been selected by ESA and are co-sponsored by ESA. We had issued call in the past where ESA funds up to 50% of the end-to-end implementation to actually stimulate the commercial demand for these services. And two examples here are Nano to Space and Greenbone, which you see on the lower side. So in other words, ESA is not only helping industry to establish commercial services, ESA has a strong interest to develop commercial demand and develop the so-called downstream sector of our program by actually providing support for these commercial customers. Now, what we have realized is that the commercial market, of course, today is not really fully existing. It's in an early stage. And therefore, we have developed what we call the Business in Space Growth Network. The intent of this network is to really stimulate demand for commercial services in future. And it's user-centric. We want to provide to the user a non-space network, which links space to non-space. We want to provide business know-how, innovative funding instrument, provide space know-how, and easy access to space. Now, in the context of this network, we have established a number of initiatives. For example, we will establish what we call a digital platform, which provides more clarity and information on what services are available and under which conditions. We will also issue additional announcement opportunities for commercial research, where again, we will fund a significant part of the end-to-end cost, but not exceeding 50%. But our flagship activity will start is the idea to establish a market stimulation program. Now, that's a new concept. The idea here is that we select a managing partner who creates a specific program on a particular application, let it be in space manufacturing or drug development. But then this is not about delivering a single project, but the managing partner would identify and select a portfolio of projects and then seek and find investors and sponsors to enable the implementation. Here again, ESA is co-funding the total program, but up to a maximum of 50%. So we will issue soon an ITT for the first market simulation program, where the intent is that we build these in 3 phases. In the first phase, we would formulate the program, define it, and this is fully funded by ESA. Then in the second phase, the first project selected would be delivered. Again, ESA would fund up to 50%, and the maximum value of the program would not exceed 10 million. But then we expect that this will become a sustainable program where ESA continues to support the program, but at lower percentage levels. So the idea in the end is that we create a network of managing partners which develop markets in different downstream areas to really, on a sustainable basis, stimulate demand, not just for ISS and what is associated to ISS, but potentially also for post-ISS infrastructures. And our strategy low Earth orbit for what comes after ISS will be strongly driven by us understanding what is the demand for science, what is the demand for application-oriented research post-ISS. Now, if you want to get engaged in any way in all these commercial activities, you have at least 4 options today. If you want to establish a commercial service, you can submit a proposal for our commercial partnership call for ideas, which is permanently open, and we accept ideas at any time. If you are interested in playing a role in this market simulation program, we will soon publish an ITT in November, where you can, of course, participate. In early 2021, we issue our next AO for commercial activity proposals, again, where we will fund up to 50% of the end-to-end implementation. These activities would make use of all the commercial services which are accessible to the European stakeholder community. But of course, you can also directly engage with the commercial partners I've mentioned and the service provider existing for exploring, independent of ESA support, concrete ideas for commercial research and services in space. Thank you. That's all from my side.
Thank you very much, Bernard. It's actually very good to know that ESA is also working in this field of commercialization and that you have some opportunities coming up in the next months. And now, since we are talking about commercializations, we will move to the private sector. And for it, we have 3 very known companies that will explain what they do. And we will start with Olympia Space, which will be talking, well, Olympia Space, which will be talking about Blue Origin. And for this, we have Olympia Kyriopoulos, who is the CEO of Olympia Space. Olympia, welcome. And you will tell us about the revolutionary space access. The floor is yours.
Thank you very much. Let me share my screen. Can you see the screen?
Yes, we can see it.
Okay. So good afternoon, everyone. My name is Olympia. I'm the founder and CEO of Olympia Space, a commercial space agency with the goal of easing access of space. And today I will talk about revolutionary access to space. And why revolutionary? Because thinking back also to my PhD time, where I had to wait many years to access a seat on a suborbital launcher, and thinking back also on the time spent for administrative part, today's space access has totally changed, and I will show you also how. So we are about to experience a major shift in suborbital space access, driven by new entrepreneurial ventures that are developing suborbital commercial systems, and one of them is Blue Origin's New Shepard. And my company Olympia Space is the official payload sales partner of Blue Origin, and we are bringing New Shepard flights to more users around the world, which is perfectly in line also with the Blue Origin vision of millions of people living and working in space. And that living and working in space requires an ecosystem, as previously mentioned also, of systems and businesses and markets that really thrive in these unique environments. So space must be wider than ever before. It must be easier accessible, more affordable and more flexible, so that we can welcome everyone from university researchers and commercial businesses to students and even artists. So our approach is step by step, as also Blue Origin's motto, gradatim ferociter, so step by step, ferociously. And here on the left, you see the New Shepard, the first rocket to land vertically from space and be reused. We will dive into this rocket, and I will summarize its capability and the payload missions to date. And just for comparison, on the right, you see the New Glenn, which Blue Origin describes as the smallest orbital vehicle it will ever build. And here's the history-making rocket. You see a series of test flights with the New Shepard. Almost exactly 5 years ago, on November 23rd, 2015, Blue Origin's New Shepard system made history by becoming the first rocket to cross the Kármán line, which is defined at 100 kilometers, and successfully returned to Earth, as you can see here, for a vertical landing. Blue Origin flies these missions out of Western Texas in the desert, near the town of Van Horn. And you can see the vehicle climbs 2.5 minutes nearly straight up before releasing the crew capsule. And then the booster returns, you can see the release. Then the booster returns down while the capsule continues its flight path. And it's really quite stunning to watch first the rocket falling out of the sky, then touch down gently, and then also to see the capsule coming down with the parachute system and really landing smoothly. So this dust that you could see before is actually the thruster system that kicks it up. So it's not really a hard landing, it's really smooth, I can reassure you. And another key feature, perhaps important to mention, of the New Shepard is also its in-flight escape system, which allows the crew capsule to move quickly away from the booster at any time of the flight. So this has been also performed already 3 times on test flights successfully. And here's, for a better understanding, once again, the standard flight profile with the apogee above the Kármán line, the 100 kilometers, which is internationally recognized as the boundary of space. And as you see, after the separation, I'm not sure if you can see my mouse. So after the separation, the booster and the crew capsule, the booster returns while the capsule continues its free flight on this parabolic arc, and then finally lands with parachutes and the thruster system. With this 100 kilometers of apogee, you get approximately 3 minutes of very clean freefall to explore a wide range of research questions from fluid physics and biology to technology testing and education. This is now the interior of the capsule, designed to fly 6 astronauts. Each person gets a window seat next to the largest window ever flown in space. And in our research flight, we basically replace those astronaut seats with stacks of payload lockers. So in total, here you can see an illustration also with the stacks inside the capsule. The New Shepard can fill up to 36 mid-deck lockers, equivalent in 6 stacks around the cabin, positioned over here. Or you can also bring your own custom interfaces up to 68 kilograms per stack. So for research questions that need also a tight turn from sample load to extraction, we can also install payloads as late as 8 hours before launch. And we're also working towards an even tighter window around 1 hour. And with the field access, you can also have your payload in your hands as quickly as an hour after landing. So the main question I think you might have is now how to build and the best your payload and how to have it also integrated. So the easiest way is actually through these standard interfaces. We can work with you to fly all sorts of custom interfaces, but the majority of users are really using these interfaces and taking advantage of Blue Origin's cabin payload system. And as you can see in this overview, there are various products. There is this single payload locker on the left side with a size of 50 times 40 times 25 centimeters and 11 kilogram of payload mass. Then the double locker that is basically twice the volume and mass of the single one, and the full stack that is approximately 6 times the single one, allowing, as I mentioned before, 68 kilograms of payload mass. And for these payload lockers, to make it also easier, we even send you a locker and a payload computer months in advance of the flight. So you can develop hardware on your benchtop and test it in flight configuration to really make sure that the flight will be a huge success. And last but not least, there is also this mini payload, mainly used for educational projects with a size of 10 times 10 times 20 centimeters and approximately half a kilogram of payload mass. So just to give you an example of research flown in a single payload locker, this is how your payload could look like with an integrated camera system. The University of Magdeburg investigated here the statistics and the collisions of granular gases. Such experiments are not essential, not only essential tests for existing theoretical and numerical models, but they are really of considerable interest also for the principal understanding of the dynamics of systems like cosmic dust or snow avalanches. And this project, by the way, was realized within 6 months from contract signature to launch and return of the payload. You might also think that perhaps 3 minutes are not really enough for all the world's research, but Blue Origin has demonstrated with over 100 of payloads with consecutive 10 New Shepard missions the opposite. So there are really a number of really interesting questions in microgravity to ask, not only in physical sciences like fluid physics, combustion, materials, technology development, but also in various applications such as life science. And some of the questions could be, how does a flame ignite? Or without buoyancy in microgravity, how does the fluid move and how does it behave? And what about the plants? How do they grow without the energy sensor? Or also cell cultures, how do they grow in 3 dimensions instead of lying flat in a petri dish? So there are many types. Also, since you come from the pharmaceutical industry, can we improve the identification of crystallization processes in your case? So there's really no border to these questions. And of course, another exciting capability are also external payloads that can expand also research possibilities. There have been something flown for the NASA. We were testing in the last mission now on October 13 with Blue Origin's New Shepard. And one of the most exciting, perhaps also for some of you, exciting capabilities that is coming soon is human-tended experiments that will allow you to be really hands-on your own research in space, rather than relying on another astronaut that is providing also a much more diverse set of subjects for biomedical research, life science, etc. So to sum up, the New Shepard is ideal for those of you who need more time than a parabolic flight can offer with rapid access. Rather than months to years, we offer a flight in weeks to months, and we can fly in an untended mode with more flexibility on the types of materials and hazards you would like to fly. And in the future, as previously mentioned, you can also conduct your own hands-on experiments. So let me conclude with two mission group pictures. There are so many opportunities with Blue Origin. Here's the booster to get space for research, technology development, education, or whatever else you envision. And both pictures should show that space missions are always teamwork. So we really look forward to seeing you in West Texas for one of our next launches. And feel free to contact me at olympia@olympiaspace.com if you have any questions for some upcoming flight opportunities. Thank you very much.
Thank you very much, Olympia. It was a very nice and clear presentation. Perhaps we will have some questions at the end of the panel. And I like a small detail that you mentioned, an example of how a flame actually behaves in microgravity, which is exactly one of the examples that our minister has explained this morning. So it's actually it's curious to see this link. Thank you very much, Olympia. And also now we will move to another commercial player that also is developing a product that offers microgravity conditions, and it's a very well-known company. Today we have with us Richard Albelo, Vice President of Business Development and Government Affairs at Virgin Galactic, who will explain us a bit what the company is doing in this field. Richard, welcome, and the floor is yours.
Good morning. Okay, are you seeing the screen?
Yes, we can see the screen.
Excellent. Well, good morning. It's a pleasure to be here today to talk a little bit about Virgin Galactic. We are primarily in the business of flying people to space, both for the experience of space, but also for research and for astronaut training. But we have, of course, a very keen interest, as does Blue Origin, in microgravity. So I want to focus a little bit on that today. This is a picture of our spaceport in Las Cruces, New Mexico. And of course, our spaceflight system is parked in front of the spaceport. The spaceport is, it's a little bit deceptive, the size of the picture. It's large enough to hold several sets of our vehicles inside. Plus, this is where we will conduct all of our training for our missions. We just announced yesterday that we will be doing the first flight from New Mexico. The launch window on that will open on November 19th, and it will be a test flight for us, but it will also be a microgravity research flight for NASA. Just a little bit about the system. Of course, it's a unique air-launched system. We have two vehicles. The first is a high-altitude, high-performance jet aircraft that carries the second piece of our system, the spaceship. And here is a clearer image of the carrier aircraft, which is a unique, slow-flying, high-altitude aircraft capable of carrying heavy payloads up to 13,000 kilograms for long periods of time. The spaceship itself is a unique vehicle. It launches like an airplane and then turns into a rocket and then lands as a glider. It uses a unique and safe hybrid rocket motor, which is when it's not engaged, when the system is not engaged, is an inert rubber compound, but once the system is flowing nitrous gas through the compound, then it is ignited and provides the thrust to get to space. And again, providing about 3 minutes of high quality microgravity. I think I have a quick video here that we can look at if this works. I don't know, are you hearing the audio?
No, we are not hearing the audio, but we are seeing the video.
Yeah, that's fine. So I can do the narration. Here's the flight crew getting ready. This was a test flight actually from our development facility in Mojave, California. Most of the team now has moved down to Las Cruces, but this is where we developed the system, and this is the flight. This is one of our early test flights. See, the system takes off like an ordinary airplane. It climbs slowly to about 50,000 feet, where it drops the spaceship. Spaceship then ignites its engine and goes horizontal for a short way, but then pretty quickly it turns up into a direct vertical flight and climbs to between 80 and 100 kilometers. And then it does this unique maneuver, which we call feathering, where the tail actually rotates up, and that's to bleed off energy as it's falling down. That's our chief flight instructor in the back of the cabin there, Beth Moses, was testing out the cabin. And here's just an image of on that mission, the spaceship landing as a glider. And our chief pilot, Dave Mackay, was the first Scotsman to ever go to space. So that's what they were celebrating there. Okay, so again, another image of that. So it takes off as an airplane, drops the spaceship, which goes up to apogee. The tail then rotates in the feather maneuver. It starts falling back in a semi-ballistic shape to bleed off energy, and then it lands as a glider. And again, hopefully you'll see this flying from New Mexico later this month. So we are, of course, very excited about this system, and we think there are numerous applications. Certainly there's spaceflight tourism, which was one of the concepts that generated this system, but there's also, we're very excited about using this vehicle as a test bed for technology development and for microgravity research. We've had a fair amount of government interest in using our system, both US and other governments, and we've also had interest in astronaut training. And of course, human-tended research will be, I think, a key goal to allow humans and payloads to interact in an environment. Obviously, if you can do the time and expense to get to the International Space Station, that would be the best place to do human-tended research. But that's such a rare opportunity, and it costs many tens of millions of dollars to do that. And these tools, these new tools, will, I think, generate an entirely new generation of researchers, and hopefully some really wonderful and cutting-edge research. Again, our system is designed. Everything is always piloted. We have had every mission has taken humans to space, and we hope to do that again. We've gotten interest from NASA. Has recently announced a program they're calling the Subsea program to do astronaut training on our systems. We're very excited about that. Here's an image of the interior of the cabin, configured for the tourism experience, but we can pull the seats out and we can reconfigure it. We're using standard shuttle mid-deck lockers, and you can see the dimensions there on the image. And those can be used individually, or they can be combine to do larger payloads, and we can carry up to 20 payloads on a flight, on a research flight, up to I think 450 kilograms and 20 payloads. Here's a image of some of our researchers preparing their experiments for the last flight that we flew. And here's a artist depiction of what a human-tended setup might look like, where you've got astronauts flying with their payloads, and so they'll be leaving their seats and interacting to conduct the research in flight. Many thanks. I look forward to your questions, and hopefully it'll be exciting this month when we start flying again.
Thank you very much, Richard, for your presentation. It was actually very good to see that video and this initiative. It's actually quite different from other offers that we see. And the last panelist that we have today, it's David Zuniga from Axiom Space. He's actually the business development manager of Axiom Space, and he will be presented today a bit more about the company and how Axiom and building access to microgravity. David, the floor is all yours.
Thank you very much. Let me see if I can start sharing my screen here. Okay, do you see my presentation, Joan?
Yes, we can see it.
Okay, perfect. Bom dia y boa tarde. I'm David Zuniga, and I'm going to help to welcome you to the next, next community's next chapter with Axiom Space. We've heard about how microgravity can improve the quality of life on Earth through research and industrial human research in pharmaceutical medical applications. We've also heard about how our community is improving access to microgravity conditions and promoting demand in space. That's really exciting. These have been really great presentations today. At Axiom, our vision is simple and bold. We see the future where there is a thriving home in space. It benefits everyone, everywhere. Our mission is to democratize space, to allow exposure to all nations, companies, and individuals. Be the provider of an eventual commercial infrastructure layer in LEO, enabling people to live and work in space and support exploration beyond LEO. To leverage our offering to grow the LEO economy and to enable sustainable development of infrastructure to sustain a continued permanent human presence in space. Infrastructure and ecosystem are key themes in this presentation, and you've heard them today already. Everybody's been talking about it. These are ideas that permeate through our organization and our community. So the reason we've done this and why we're pursuing something so audacious and bold is because of our people. We have long-standing expertise in human spaceflight. Axiom leadership has been involved in every ISS mission since the inception of the program. No one knows the environment and how to ensure reliability and safety in LEO better than the Axiom team, including Michael Straffordini, the former NASA ISS program manager. In order for our platform to be successful, it's important to offer diversified services. We're supporting flying astronauts to orbit, performing research, and enabling the spaceflight community to explore our solar system through our technology development. We're an optimal platform from which the world's spacefaring nations can explore sustainably to Moon, Mars, and beyond. Our platform is going to support nations who want to put their citizens in the world and to help provide citizens flight. Michael Lopez Alegria, U.S.-Spanish dual citizen, Axiom's VP of Business Development and four-time astronaut, will be commanding a mission to the ISS with Axiom in 2021. Our goal is to expand on the affordability and access in microgravity research. Our leadership team gives us the ability to provide a robust capability in LEO. We'll be able to support the ISS research capability of today and to expand the depth and breadth of the activities that we do in orbit. Microgravity presents the physics that's enabled to change the way we think about the world. It means making things in space because they perform better on the ground, but also making things in space for space. Just think about that. Sedimentation, buoyancy, convection are all important physics that play a part in designing new materials and building new products. Note that I said designing new materials. That's powerful. It's not just building things, it's the community is going to be building the forefront of design and innovation in a fundamentally new way. Carl Sagan once said, "Exploration is in our nature. We began as wanderers and we are wanderers still. We have lingered long enough on the shores of the cosmic ocean. We are ready to set sail for the stars." Axiom truly believes that a journey begins in Leo, but expands into the solar system and beyond. Our platform, our space station, will serve as the testbed for explorers for the future, as they develop the tools needed to sustain life for longer durations and learn how to extract and utilize valuable resources that will both support life and provide locally sourced fuels. In addition to the typical facilities found on spacecraft buses such as power, thermal control, and GNC, our human-rated platform, I'll underscore that, will provide crew, water, gas, research, instrumentation, data consumption capability, or data computation capability, and tie into the network of other spacecraft in orbit. Like the ISS, we anticipate supporting deep space exploration. We're offering these services commercially with commercial partners and contracting. That's an important point. We've already begun building the successor to the ISS. And while we're building the Axiom station, we'll be flying private astronauts and researchers to the ISS. The ability to attach the ISS, our port award, is a tremendous opportunity because it not only gives us the ability to test our space station in space cost effectively, but it also creates an easy path for ISS customers to move on to Axiom station. Ultimately, we're going to be a free flyer and detach from the ISS where we build the ISS successor. We have the ability to add additional modules over time, which allows us to expand our capability as the market grows. We'll have our first module attached to the ISS in 2024. Our second module following 18 months after. Our manufacturing facility will be on board in 2026, and that will be succeeded by our power and thermal module in 2027. We'll be a free-flying space station in 2028. I wanted to give you a view from our Earth Observatory. Just imagine hosting a dinner party from here. The view would be out of this world. I'm sorry, I had to throw that in. This is a view of the inside concept of our HAB. It'll provide crew quarters for a crew of 8. And down here, you see one of the crew quarters below. We're working with famed design and architect Philippe Starck, and he said that the vision for crew quarters is a habitation on Axiom station to create a comfortable egg that is inviting with soft walls and designed perfectly in harmony with the values and movements of the human body in zero gravity. We're thinking out of the box. Our crew quarters will not be like any crew quarters ever designed. The ISS enabled partners to collaborate on a platform. Our platform will enable anyone on the planet to innovate in space. That's another really important point to think about. Anybody on the world to collaborate in space. So Portugal, if you're listening, this is an invitation. Esta o su convite. Please don't hesitate to reach out, to dream and brainstorm with us. Again, I'm David Zuniga, and you can reach me at innovate@axiomspace.com. And if you're interested in career with Axiom, you can visit our career page. Don't forget to check out our refreshed website in the coming weeks, www.axiomspace.com. Thanks so much for your time.
Thank you, David. Thank you for this presentation. Actually, I think that the future looks very bright and very promising. So I want to thank you all, Dave, and all the panelists for your presentations. Now, I don't see any questions specific from the audience, but I have also some questions that I would like to address. And maybe I will start perhaps with Bernard. I don't know if you are here. Yes. If you hear me, Bernard.
Yes, I do.
Okay, perfect. I wanted to ask you if you could provide us with more information about, for instance, Space Rider. If you could tell us, for instance, how is this experiment selection process going to work, and if there's going to be an ITT and so on. What's a bit the time frame? When are going to be the first flights, and how recurrent is going to be? So I would appreciate if you could provide us a bit more information.
Well, I'm probably not the one to talk about Space Rider because it's managed by our Space Transportation Directorate. Okay. But yes, I think there is an intent. Clearly, there will be opportunities for flying and accessing Space Rider commercially as well. I think there's still in a definition phase of how all this will be implemented. What I can say is that when we develop the Business and Space Growth Network, and our intent is to stimulate demand, that we consider Space Rider as an eligible service where we would co-fund research activities making use of Space Rider. So hence, our market stimulation program is not focused on ISS solely. We're looking at all providers, including the ones which have just delivered excellent presentation. Again, our intent is to stimulate the downstream and see whether there are markets to make use of future commercial services, whether they're operated by ESA partners, or non-ESA partner, or even international providers.
Thank you, Bernard. And I have here a message from Jennifer, also from ESA, that says it can also provide some extra words on Space Rider. So Jennifer, if you want to complement.
Yes, thank you. Can you hear me? Can you see me? All right, perfect. So just a few words to complement what Bernhard already mentioned. Space Rider is not yet an official research platform in our portfolio. The maiden flight of Space Rider is foreseen in 2022. So we have to see whether our colleagues will be able to launch Space Rider by that time. If it is confirmed that Space Rider will have its maiden flight, we're looking for candidate experiments that can be accommodated there. Once we're closer to confirmation of getting payloads or flight spots or flight opportunities on Space Rider, we will most likely release an announcement of opportunity to which scientists or interested parties can then apply. And those that fit technically and are feasible will then be able to fly on board of Space Rider. But we're still in a fact-finding phase, and we're still waiting for actual confirmation of the flights of Space Rider. But once it has materialized, we will open it up for research to the wider community.
Thank you, Jennifer, and thank you, Bernard, for this clarification. It's good to hear. I also have one question. Perhaps this one is more for Olympia. Olympia, you have been explaining a bit what are the possibilities with flying with Blue Origin, but also what I want to hear maybe more, it's how often is Blue Origin planning to offer a flight opportunity? And yes, I wanted to hear it's a bit how often, and exactly, yes. And you're talking about mainly about suborbital flights. In the future, is Blue Origin also planning to offer orbital flights, or what's the plan?
Yes. So let me answer your first question. I like your last question, basically. As you know, the motto is really step-by-step, ferociously. So the approach of Blue Origin is really exactly the same. So they're building now, or they've built the new Shepherd, and they're testing also hardware for the new Glenn on the new Shepherd, such also as the engine and other equipment. So there will be definitely this orbital launcher called the New Glenn, and there will be even lunar missions like with the Blue Moon, and the suborbital missions will still remain, especially for the research community. So because we have been asked this also several times, what happens if the New Glenn is ready? What happens to the New Shepard? Will it continue flying, or will the New Shepard then also stop flying because basically you don't need any more of the testing and then you have already your orbital launcher, which is really not the case, because there's a huge demand also from the microgravity community. And to answer your first question, Blue Origin's goal is right now to fly approximately twice per year. And as I also mentioned, there will be human-tended flights coming up. So there will be also these additional missions. It really depends on the demand. So we can also fly 4 times per year or even 8 times per year. I mean, if there is such a huge demand, the rocket is there, it's reusable. We can launch, land, repeat as the customer requests. But so far, let's say, to have a full capsule, there's, let's say, this stable mode right now of 2 flights per year.
Thank you very much, Olympia, for the clarification. Yes. And my next question, maybe it's addressed to Richard, actually, because Richard, for what I understand, one of the main advantages of your system, the system that Virgin Galactic is offering, is the possibility that you are basically taking off and landing horizontally. And therefore, basically, you only need a runaway to operate, a runaway and a control center. And what we wanted to ask you is, how feasible do you see the possibility of Virgin Galactic actually landing in other spots beyond the States, landing, for instance, in Santa Maria Island, which has a runaway of almost 5 kilometers?
Well, I think our longer term corporate vision, you have to imagine it in stages. The first step is obviously to get into routine commercial service where you're routinely doing hundreds of flights a year. And we're going to do that from Las Cruces, New Mexico. But then a next step in the progression would be to have international spaceports, probably one in Europe and one in Asia, one in Europe or the Middle East and one in Asia. And that would be step 2, where we would have the same kind of operations, perhaps with more advanced vehicles, but conducted from different locations in the world. And then the third step, and it's something that we have announced previously that we're working on, is point-to-point transportation, where you would actually connect your various spaceports with high altitude, very high speed aircraft that would be based on some of the technologies that we're using now, but also next generation technologies. So with that vision, you would actually have a series of interlocking spaceports that were also providing high-speed terrestrial transportation services. So that's been the vision that we have been pursuing. And obviously we're still at the very, very first step now, but that's the longer term vision. But specifically the spacecraft that I just showed in the movie, the current spaceship, is not capable of prolonged horizontal flight. It's designed uniquely to do its mission, which is a short horizontal flight, and then a much more aggressive vertical flight, and then a glide down. Horizontal would impose, well, it would impose a number of other technical challenges.
Thank you, Richard. Actually, it's quite clear and it makes perfect sense. I have a question here from Paulo first, and maybe I will answer this question, but it's a very short one. Paulo is asking, it's congratulations on all the presenters, and I also do the same for the presentations, and he's asking if there are any Portuguese governmental or international, namely European funds, to help pharma companies to engage in spatial research and development. Well, from my side, and I strongly recommend that to Paulo that if he has ideas, he approaches Portugal Space, and we can certainly discuss it. But the first thing I can comment is that Portugal Space has subscribed the exploration program at ESA, and also within the exploration program is a sci-space program. Therefore, being in that program offers the possibilities to apply for the different research and development opportunities that appeared, as have been shown in sounding rockets, parabolic flights, or in the ISS. So what I would say is that the first thing that I strongly suggest is to approach us, and then we can discuss this in more detail, Paulo. And then there's a question here from Denise. Yes?
Hi, this is Olympia, sorry. If I may add something to this.
Yes, yes, please, Olympia.
As I mentioned also in my last pictures, space missions are really teamwork. So we have also seen with Blue Origin, with the New Shepard missions, a lot of collaboration between US universities and European universities to also share a ride and to benefit from each other, from the funding, maybe through the NASA Flight Opportunity Program, whereas then the European university would deliver the hardware, for example, and then like this, it could be also shared. Just as an idea also to mention this.
That's very good, and perhaps Deva can complement this, because Deva is the director of the MIT Portugal program, and it's a very clear example of this collaboration. And actually, we had a presentation before from Ligia, who was explaining this, basically how they are partnered with Working to Fly their experience. So Deva, if you want also to give some words on this.
Yes, thank you. I'm here. I can't get my video on. Maybe someone can let me in. But anyhow, I'm very glad to comment. Oh, there we go. Wonderful. Yes. So under the MIT Portugal program, that's exactly it. Space is global now. So we're just looking for all opportunities, and we're very glad to have our suborbital campaigns. So we had a really successful flight with students. The first time Portuguese students got to design and build and fly and experiment. And now we have our second one coming up this year. So we're just going to take advantage of all these opportunities. And so again, working across the Europe and with universities worldwide, just want to facilitate, because we don't know any better way to inspire the next generation. I call them the Mars generation, to be able to really, design and build and get that space flight data. And the time cycles are so important. As a researcher and a PI, it takes me a decade to usually fly an experiment, but now students can participate, and in literally weeks and months. So within a 1 year cycle, you can design and develop and fly an experiment. So it's really exciting.
Thank you, Deva. Yes, actually, this cooperation agreement is actually an excellent initiative. And I have here one question from Denise, and it's a question for Richard. It's a technical question. I don't know if you can answer, but basically what Denise is asking is if Virgin Galactic will be able to supply a commercial refrigeration incubation module system. I don't know, Richard, if you can answer this.
Right now, the way that we're not providing a lot in the way of fixed laboratory hardware for the researchers. Typically what will happen is we provide the space, and then the researchers bring us their payloads and their experiments. And on something like a commercial refrigerator, so for example, we don't have one that we can offer you, but there are certain classes of tools that I think will come into being common, like glove boxes and refrigerators and things like that. I think we're just at the early stages of the suborbital microgravity industry now. But in terms of what is possible, we do have power and weight limits. I think we're limited to about 50 pounds per experiment, or sorry, 50 watts per experiment on power, and each stack of 4 is 200 pounds. So it depends on how much power a refrigerator would draw and how much it would weigh, and so we can accommodate. So if there's something that's already built, and if it fits that mid-deck locker form factor, we could probably fly it, assuming it's in the weight and power limitations that we have.
Thank you. And I have perhaps a question. It's more for David, because Action Space is actually planning quite ahead in the future. You plan to send your first module to the ISS in 2024, for what I understood, and then to detach from the ISS in 2028. And perhaps my question is also related to the business development network that ESA is developing to try to foster commercial applications. So my question, David, is what's your plan actually to engage with commercial clients to utilize your space station, not only for space tourism, but also for commercial applications where they can develop some products?
No, it's a good question. And so, I mean, between now, when we're starting to build our station, and by the time we have it up in 2024, we're working on developing that pipeline. And so initially we're flying research through the International Space Station. We're working a lot through the International Space Station Lab as an implementation partner to integrate folks' research onto the ISS. So we've got a couple of projects right now, for example, that are in the area of in-space manufacturing. So as folks kind of develop these use cases, and then they reach out to different funding agencies like SBIRs or NASA research agreement funds, or even there's funds through cases that sometimes flow as well. We will essentially help to integrate them onto the ISS. And as we start building that pipeline, like I mentioned earlier in the presentation, it'll give us a really easy way to then transition those researchers into Axiom Station. And so by building that infrastructure first through ISS, we're getting a lot of leverage to be able to then evolve our infrastructure as we sort of develop our research capabilities and facilities.
Okay, thank you, David. So we are actually coming to an end. I don't know if anyone from the audience has another question. If not, what I would like to do is I would like to thank Dave, Richard, Olympia, Bernard, and David for all your time. I enjoyed very much these presentations. For me, the future looks very bright, and actually how you are going to provide access to other sectors to do microgravity research. So thank you all for your time and for preparing these presentations. And I would like to finalize making a small summary of what we have had today in this workshop. We started this morning giving a more of an institutional point of view of why space is important in Portugal and what's actually the current status, both from a governmental point of view, space agency, ESA, and certainly from a medical agency that represents many associates. Then we have gone more into specifics on what's the SciSpace program of ESA and understanding why it's important and what are the platforms. Also, we have discussed a bit with industrial players, how do they develop payloads for scientific research? And we have seen actually a very specific application from Portuguese students that they did a very nice experiment. And then we have gone more into pharmaceutical and medical applications, very specific cases where space is bringing actually a lot of benefit to the society as a whole. And then we have heard Space Pharma as a company that's actually providing a platform that gives this access to these conditions. And now in this afternoon session, we have gone more into access to space, what the future is bringing to us and the present, and commercialization efforts. And with this, I believe that we have all gotten a broad overview of this very fascinating topic that Portugal actually wants to promote very much. So I want to thank you everyone for your time. I want to thank you all the audience also for attending this very long workshop and very interesting one, and hope to see you soon.